Good morning, everybody. Welcome to the Stewart and Heaton Masterclass today. So to get started, Good morning. Good morning, everyone. It's nice that you're catching up, but we do need to get started. So welcome to the Stewart and Heaton Masterclass today. And to get things started, I'll hand it over to Rob. So wherever Rob is.
Rob is here.
Okay.
Hi, everyone. Rob Webb's my name from AFAC, and I'm delighted to welcome, or at least open the proceedings today. Before I do start, I'd like to acknowledge the traditional owners of the land that I'm coming to you from, the Wurundjeri people of the Kulin Nation, but also acknowledge the traditional owners of the lands around the country, whether it be the Gallagher people of the Eora Nation, where the people are meeting today in Sydney, or anywhere in the country. And also want to acknowledge any Aboriginal or Torres Strait Islanders in the audience today. On behalf of AFAC, I'm really delighted to welcome you this morning to the Stewart and Heaton Masterclass. The title today is Wellbeing, the Tasmanian Context. We want to thank our sponsor deeply, Stewart and Heaton, for their continued work in this area and making this masterclass as accessible to everyone as possible. It's vital for everyone in the sector, inside and outside the fire and emergency services sector. It's vital that we continue to tackle the mental health challenge, and events such as these are really important to move us down that path. As part of the AFAC conference each year, we call for nominations for the Leading Practice in Mental Health Award, sponsored by Stewart and Heaton. And in 2021, the Department of Police, Fire and Emergency Management in Tasmania was awarded the award for their MyPulse program. And I'm delighted to hand now to Chief Officer of the Tasmanian Fire Service, Dermot Barry, to open with an opening address to talk to you about the program.
Good morning, thanks Rob. Good morning everyone, I'm Dermot Barry, I'm the Chief Officer of the Tasmanian Fire Service. I too wish to start by acknowledging the traditional custodians of the various lands in which you all join us from today, and the Aboriginal and Torres Strait Islander people who are participating in this event. I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and the waters across Australia. Well, greetings from sunny Hobart. I see the program has me slated for a 10-minute opening address, but let me assure you I will take nothing like that long. The Tasmanian Fire Service is proud to have been selected as the winner of the Stewart and Heaton Leading Practice in Mental Health Award for 2021. It's my pleasure to be opening today's masterclass. The focus of today is to look at the Tasmanian context. We've also included an important session by Maree Riley from the Australian Antarctic Division. Maree looks in detail at the unique challenges that are faced in providing wellbeing services to those in extremely remote locations. From an emergency services perspective, today is about briefing you on some of the approaches to physical health and mental health, with a particular emphasis on MyPulse. MyPulse, which won the Leading Practice in Mental Health Award, is something I'm particularly proud of. I've completed both MyPulse surveys, one for mental health and the other for physical health. I can assure you it's as simple and effective to do. I'm sure you'll enjoy hearing of its development and the lessons we've learned along the way. Also, we'll step you through our approach to the wellbeing support. We have a unique service delivery in Tasmania, which we deliver to all our emergency services. It involves multi-agency peer support programs and a centralised management structure. Personally, it's tremendous to see the evolution of mental health support for our first responders. When I first joined the Army in 1980, there was still a cohort of those senior non-commissioned officers who'd served in Vietnam. As a young fellow new to the service, I was advised to avoid them after hours, and especially when they'd been drinking. When you reflect on it, I'm sure these poor veterans, who are clearly suffering what today we would know as PTSD, would start self-medicating often early in the afternoon and would find solace in keeping to themselves and keeping with another small group of veterans. Unfortunately, they'd also get angry and at times could get violent. Even when I joined the South Australian Metropolitan Fire Service in the mid-1980s, the idea of counselling and support was unheard of and was considered soft. Real men weren't bothered by this stuff. Unfortunately, we know now that each and every incident we attend has an accumulative effect on us, and this accumulation can be like the death of 1,000 cuts. Again, unfortunately, the use of the liquid crutch, as we used to call it, was often the medicine of choice. And for many of those firefighters, retirement was spent fighting alcoholism and health issues. Fortunately, our culture has evolved now where the hero culture is gone and now seeking support is considered routine and sensible. The focus has gone from treatment to prevention, in essence putting a fence at the top of the cliff rather than more ambulances at the bottom. Fittingly, today's masterclass will conclude with an overview of our response to the Hillcrest Primary School tragedy in which 6 children died and which continues to have a lasting effect on all our first responders and the community at large. In closing, let me say that I recognise that the best opportunity we have to make a real difference is we all learn from each other. I encourage you to stay actively engaged throughout the day, and I'm sure you'll all take away something today that will help you make tomorrow better, either for yourself or for one of your colleagues. Thank you, enjoy today, and back to you, Rob.
Right, so just a little bit of housekeeping, but thank you, Dermot, and thank you, Rob, for those words. So just before we continue with the day, I'll just mention a few things. Just a little reminder, if you haven't already switched your phone to silent, if you could do that, that would be really good to do that now. And I must remember I need to check mine when I sit back down. Some emergency protocols. So if we do need to leave here, if there is an emergency, we just go down the stairs outside the door here, exit through the front foyer and out onto the street. Today we'll be using the feature, a Q&A feature with Slido. So we're able to take questions from participants both here in the room and also online. So post your questions and using the link to the QR code, which is on the screen and in the delegate handbook. So if you can access that, that would be good. For those of you that are online, I encourage you to use the chat window to share your thoughts and reflections. And I notice there's a few on there already, which is really good. If you can, just a reminder that you'll need to select the everyone icon or something, whatever's on there. And so that everyone can then view your messages. I would also like to remind you to be respectful of each other and the presenters when posting comments or questions in there. This next point, it's important that some of the information that or some of the content of today's masterclass may cause a trigger or have some effect on you. It does include mental health, suicide, isolation, and references of mental health disorders. So if you are triggered, please let you know that there are resources to help you, and you may want to have a discussion, or if you're feeling uncomfortable about anything or any of the content as well. If you do need to leave momentarily, please do, and somebody may actually check up with you as well. But if you do need to leave, please do that. So on that now, I'll hand over to, I think, Matthew.
Thanks, Anna. Thanks, everyone, and thank you to Stewart and Heaton for continuing to fund the masterclass. I might just start very quickly with introducing the Tasmanian table. Sam Sneddon will be involved in this presentation with myself, as will Andrew Taylor and Greg Butters. We then have Maree Riley from the Australian Antarctic Division, and of course Anna Lang, who you've just met. I'm thrilled to say that none of us are related, almost unheard of from a Tasmanian context. And it came as a shock to us when we just discovered that then, so that's quite interesting. What we'd like to talk about firstly is MyPulse. And MyPulse is something which I wasn't involved in the development of, but sorry, I wasn't involved in the background thinking behind it, but I have been involved in the development of it. And I can say, hand on heart, that I am absolutely stunned that we have the sorts of services that are available to us through MyPulse for all of the emergency service workers. And in our view, and of course we're slightly biased about this, we believe that it's a gold standard when it comes to services for emergency service responders. Now, this is my 39th year in policing, and I've existed in the organisation from when we had one staff member who might have known a little bit but not too much, right through to today. And you'll hear during the course of this afternoon's presentation the incredible breadth of services that we now have available to people. So if we could go to the next slide, please. So as you can see, we're going to go through the background, the development. I've asked in particular Greg and Andrew to talk about some experiences that they've had firsthand, or alternatively, some changes in culture that they're actually starting to see in volunteer fire brigades particularly. And of course, as with everything that gets developed, we don't do it right the first time. We will talk to you broadly about some insights that we've had, some lessons that we've learned, and some things that we would do differently if we actually had the opportunity. I think what we would do differently is a key one, because we did make some big mistakes, but those mistakes were made purely for budgetary reasons. We were mindful of what we should do. Unfortunately, we weren't in a position to do it right at the outset. So next one, please. Just play a short video. So one of the things that I'll just quickly talk about there, which I think is really interesting, as you can see along the bottom of the slide here, we have the Festival of Logos. And we're an organisation, we're embedded within the Department of Police, Fire and Emergency Management, but we actually provide services to every emergency service agency in the state of Tasmania. So we have Ambulance Tasmania, the Department of Police, Fire and Emergency Management proper, the Forensic Laboratory, the State Emergency Service, the Tasmania Fire Service, and Tasmania Police. So we cover the entire gamut. And that's why when we had that video, which was a lived experience video, and each of the people that is represented in that video has their own lived experience video, which is available on the MyPulse website. We wanted to inject that it doesn't matter whether you're a volunteer or your career or which agency it is that you represent, that mental health is important for everyone, and we need to proactively take action which is in our own best interests. So we're very fortunate in that we were able to utilise some of the background material from Victoria Police, because that's one of the big things that we've learned, is that you shouldn't take all the steps yourself, because very often other people have trodden the path before you, and if you can benefit from the information that they've got, then it's certainly worth doing. So in 2017, it was well recognised within Tasmania that we needed to do something significant for the emergency service responders. We just had a number of suicides, 4 suicides, 1 paramedic and 3 police officers. And as a consequence of that, the emphasis was very strongly put on actually trying to do something proactive rather than what had been happening before, which was slapping the band-aid on after the event. So there's a quirk of history here and there, which I'll talk about this afternoon. But essentially, the Department of Police, Fire and Emergency Management recognised that in order to demonstrate best value for money, it would be important to include Ambulance Tasmania in whatever it was that they were putting a budget bid for. And so when we went to government with our finalised business case, Ambulance Tasmania was very much front and centre in the direction that we were intending taking, and they were full players, so they were very much committed as well. In 2018, the funding was obtained, and the funding is 1.5 million per annum. That's how much we've been able to allocate to do a whole range of things under Project Wellbeing. And the project was then well and truly set up and pushed forward. We went through that horrendous government process of a request for tender and all the negotiations that followed that, and then the contract deliberations. And I was lucky to come in only at the back end of that as we were pushing it through. We were doing a number of other things around Project Wellbeing at this time. And we developed a program which has been tremendously successful. It's called Ready for Response. And Ready for Response is a 12-week fitness and nutrition program that is available for all emergency service workers in Tasmania and also for all state service employees within Ambulance Tasmania and the police department. We've had up to 900 people participating in Ready for Response at any one time. We've been using gyms right across the state. And we actually found that there was a real commitment to camaraderie and a real commitment to an increasing morale just because our people were able to exercise alongside each other. We were really fortunate. We've got a lot of people at the senior level within our organisations that commit to healthy lifestyle. The Commissioner of Police, for example, runs marathons. And we would find that the Commissioner of Police, the Deputy Commissioner, and as I say, other senior police officers would be exercising alongside the emergency service responders. We've actually had Ready for Response evaluated by Edith Cowan University. It's been found to demonstrate a 50% reduction in stress and anxiety. And we look forward to, in the future, being able to publish the results of the evaluation that they did. So whilst we're going to talk today primarily about MyPulse, please just understand that Project Wellbeing was significantly more than just MyPulse. It did also allow us to put on additional staff, and we created some additional wellbeing support officer positions and created the entity which became known as Wellbeing Support. In 2019, in September, we actually launched MyPulse, and the launch was quite heralded within the emergency services. Significant engagement from the leadership, which was incredibly positive. And as you saw there with Dermot, very happy to put their hand up and say that they've actually stepped through the process themselves. So that's been very positive. We launched initially with the website and the physical health screen. And then in October of 2019, we launched the mental health screen to coincide with the mental health celebrations. Now, our first mistake was that we could only make it available to career people at the start, so it wasn't available to volunteers. And we owe a great debt to Andrew for stepping into the political fray and securing funding for us to be able to open it up to all volunteers. And subsequent to that, we've also now been able to open it up to all of the state service employees that work in our department. One of the really interesting things, and I think it will be a challenge for government, is that now that our department and the state service employees attached to Ambulance Tasmania have access to this, there are lots of other government departments that are actually saying, what about us? And the Department of Justice has recently rolled out a different version of MyPulse, which is substantially different. And it will be interesting to see where we actually end up. We've been able to get involved with a lot of other organisations in Tasmania and also on the mainland, and there is quite some appetite for a program such as MyPulse, but of course it does come with a price tag. The next one, please. I do just want to say that Tasmania has got over 9,200 emergency service responders and state service employees that are involved. It's around about 3,000 career emergency service responders. The number seems to be growing and there's quite a number of casuals that are involved there. But one of the really important things, of course, is to make sure that MyPulse is available in exactly the same terms to every single person. And that wasn't the case for the first couple of years, but we have been able to get there, as I've indicated. So whilst the numbers may pale into insignificance next to some of the numbers that you're talking about, I think it's reasonable to say that that's quite a cohort of the Tasmanian population that's involved. I'll just hand over now to Sam.
Morning, everyone. If I start speaking really quickly, it's because I've had 3 coffees, so please excuse me. So there are 13 different versions of MyPulse, and I have the lucky privilege of working with Matthew and the Wellbeing support team to manage the back end of the MyPulse program. So I work for Gallagher Bassett, and we were the successful tender to run the program for the Department of Police, Fire and Emergency Management and Ambulance Tasmania. I'll draw your attention to the visual there on my left. You can see 3 different tiles. This is the front screen of MyPulse. So when a user goes to mypulse.com.au, this is what they're presented with. The reason that there are 3 tiles there, the left one is for Ambulance Tasmania, the middle tile is the Department of Police, Fire and Emergency Management, and the tile on the right is for family, friends and others that care. The tile on the right, the families tile, I want to make note that that's a public tile, so any of you can actually go into that tile and view the resources and tools and services that we have that are available to the public. The 2 tiles on the left-hand side, though, however, do require a participant to log in using their departmental email address and password. And the reason that they are 2 separate tiles is because Ambulance Tasmania comes under the Department of Health and obviously then Department of Police, Fire and Emergency Management in the middle there. So how we're actually able to have 13 different versions, and you're probably wondering why there are 13 different versions of a website, is because we tailor the MyPulse website specific to each user group within those agencies. So how we do that is when a participant logs in, they need to use their departmental email address and password. Then the MyPulse website has got a secure link through to the identification management system within each department to authenticate those participants that they are actually able to access this. They're not a member of the public, for example, and to see which user group that they belong to. So Matthew mentioned in a previous slide that we have volunteers, we've got state service employees, and we've also got our career personnel. And each of those 3 different levels have, or in the beginning, I guess, and it did have slightly different access to different services, which Matthew touched on, but also it enables us to tailor each of those individual pages specific to that role type. So we may have resources and tools that are more relevant to police, for example, or we want to only show to police. So those appear on that police website, and it just enables us to have that sort of differentiation between role types. Since the launch in September 18, we've had over 18,000 web sessions. So that's when someone logs onto MyPulse, that they browse around, for example. So we're quite proud of that number for such a small state. And with all the content, and we'll go into a bit more of the content, as we go through the presentation, but with all the content, we want to make sure that it's emergency service responder specific. So it's really tailored to emergency service responded, and wherever possible, we make sure it's got the Tasmanian context as well. The next slide, please. So on this slide, this is, I guess, some of the key components that are available within the MyPulse program. We have virtual learning tools, we've got a resource library, topic hubs, videos, and then the following assessments I will go into a little bit further on the coming slides. What we try and do in MyPulse is we try and display information in multiple different ways, because we all learn in different ways. And some people are more responsive to videos. Some people, really do learn from the online e-learning modules. Other people like to do a little bit of, research on particular health and wellbeing topics. So we try and reiterate, I guess, the information that is available through the resource library in multiple different formats. And hopefully, one of those formats will suit the individual person who's browsing through the website. The cancer risk assessment, we've got a slide on that a little bit further on. That's an online health risk assessment, and that covers through the 12 presumptive cancers. The lung function test, that's available to our Tasmanian Fire Service firefighters only. And as I mentioned earlier on, how we were able to tailor the different websites depending on the user, that one will only appear on the TFS versions of the website. We've got our health clinic consultations. Think of these as corporate health checkups. This is where we go around the state and we check in with people who have 20-minute consultations. They're free, they're private, and they're confidential to all Tasmanian Emergency Service responders. And it's checking in on things like blood pressure, BMI, blood glucose, health, height, weight, etc. And then we've got our mental health screen and our physical health screens, which we'll go through in just a moment. So the website has been around since September 2019, as I mentioned. In September last year, we hit the 2-year period of being live, and it felt like it was a really good time to do a review of the entire website, just to make sure that it was we were maintaining that it was contemporary, that it was on point, and it was meeting the needs of the emergency service responders right across the state. So we then embarked on a full website refresh. And we looked at all of the content, we looked at all of the imagery, we took on feedback from the 2-year review from emergency service responders. We overwhelmingly got an enormous amount of gratitude and appreciation from emergency responders about the program. It's very dear to their hearts, and they're very pleased that they've got something like this available to them. Some of the feedback that we got was that they wanted the program, although they loved it, they wanted it to be really user-friendly and really easy. So we thought we'd really nailed it in the beginning, but we've been able to fine-tune a few things along the way with that continuous improvement lens, just to make sure that we're staying really on point and meeting the needs of emergency service responders. We've got a QR code there. We're all pretty used to QR codes at the moment. And although this is not rocket science by any means, it's just one simple way, and you can click on that if you like. That will actually take you through to the MyPulse website. It's just one simple way that we can make accessing the product easy for our people. So we can put that on posters, etc., and we can have that right around the state. We've got it on business cards, which we regularly hand out to personnel when we're meeting them face to face. We've also created, based on feedback, coaching completion certificates. So this is for people who have gone through the MyPulse coaching program. They've completed the program, and there's a great sense of pride with participants that they have completed the program. So we decided to reward or acknowledge, I guess, more so their commitment to their own health and well-being, and we've now generate completion certificates. Once again, it's not rocket science, but it's just acknowledging that health and well-being is really important. And when people do focus on their health and well-being, we just really want to acknowledge the magnitude of that. Another thing that we've created from the 2-year review is what we're calling topic hubs. So on MyPulse, there's a whole range of resources, ranging from nutrition to physical exercise, looking after your mental health, stress management, sleep management, etc. But what we wanted to do is to make sure that there was a way in which people could navigate through the MyPulse website, hone in on a particular topic that was interesting to them, and then provide them with a pathway. So a pathway to help them, recover in that aspect, or to learn new information in that aspect, or try new things to help them on that journey. We already had in existence the mental health and the physical health coaching pathways, which we'll talk about shortly. But if someone didn't fit into that coaching pathway, we wanted to make sure that there were other pathways, because there are other aspects of mental health and physical health that are important. And so there was topics in which people could follow to progress. Next slide, please. Here we've just got a couple of visuals of what the MyPulse website does look like. Once again, I do encourage you to jump on and have a look. You can follow the QR code. Also, you can just go to mypulse.com.au and then click on the families tile. That will take you through there. But here's just a bit of a snapshot. The website is set out very simply, and it's through a series of tiles. Each of these click through to various information. We have information and resources which you can download and take away with you or share with a friend. We have links through to resources and tools online that are relevant to emergency service workers and the Tasmanian context. Also, there are articles. Articles are either written in-house by the Wellbeing support team or through Gallagher Bassett if we've got articles which are relevant. But we've also reached out to specialists in the field, and we're working with a cardiologist at the moment to prepare some articles for us. Next slide. These 4 tiles here, excuse me, these represent probably some of the key elements of MyPulse. So we've got our mental health and our physical health screens. We've also got our cancer risk assessment, which I've talked about briefly for our Tasmanian Fire Service firefighters, and we've got our health clinic consultations. These 4 tiles, when you log on to MyPulse, are front and centre as probably some of the key stuff around MyPulse. So I want to make sure that they're right up there and they're visible and sort of easy to access. By clicking on each of these tiles, it then takes you into that pathway, so then you can follow the mental health screen or follow the physical health screen, for example. And now I'll hand back to Matthew to talk about Edith Cowan and some of the insights we've received from their research.
Thanks, Sam. There are a couple of questions that have just come in that will be answered in the next couple of slides. That hopefully will achieve what we need to achieve. So we commissioned Edith Cowan University to undertake a 3-year evaluation of Project Wellbeing, and in particular looking at MyPulse, but all of the wellbeing services that we're providing through the department. There was a baseline report that was done in 2019-2020, and we have done 3 pulse surveys so far. Our response rate is generally around the 500 mark for each of the surveys that we're doing, so we're reasonably comfortable with the response rate. And we are actually looking just to adjust some of the questions to focus in on particular issues that we're seeing arising from a sort of across the passage of time. Now, one of the big issues that we've been able to identify is that some of the things that we hadn't thought were issues were actually issues. And one of the ones that leaps out to me is the extent of sitting that our emergency service responders are doing is significantly more than we'd actually identified through any of our observations or any of our research. Now, that has led to quite significant health consequences, and it has helped to validate the use of the Ready for Response program and to increase its use over the coming period. But we've also been able to identify that there are issues with managers and what managers are actually saying to their people as being different to what managers might be saying in other contexts. And so there's a degree to which our people are reporting on the hypocrisy of managers and supervisors. But one of the other things that we actually didn't identify at all, and this has been a big one, is that the people who feel the least supported in our organisations are actually the managers. And so we will shortly be running our next Pulse survey, which will be just focused on managers and supervisors to try and identify what it is that they are actually looking for and where the gaps are for them in terms of the level of support that they're receiving from on high. The other matter that came out to us is alcohol consumption. And we found that the alcohol consumption rate was more problematic than we'd actually identified it to be as well. This did come as a bit of a surprise to me because with my background in policing, we do random alcohol and drug tests throughout all the police stations across the state. They're done 24 hours a day, 7 days a week. You can't game them at all. And we have not identified any issues whatsoever through our alcohol and drug testing, but we have now identified it through the evaluation that Edith Cowan University has done. One of the big points that we have committed to with Edith Cowan is that as they identify issues and they make recommendations, we will adjust everything that we're doing so that we're not waiting till the end of a 3-year result and then go back to identify a problem that was identified on day one. So we are tweaking the process as we identify the issues that need to come to the fore. One of the, obviously Tasmania is the best state in the nation. And we're certainly getting all of the green refugees coming down our way at the moment. So we do have a lot of satisfaction in society generally with our standard of living and the life that people are able to lead, I should say, within Tasmania. But we were finding that there were extraordinary pressures on people to get their work done whilst they were at the emergency services. And it's been interesting to note that the pressure that our people are reporting, and particularly amongst our career people, has been extreme. And so we are now needing to try and identify what else can be done from a wellbeing perspective to try and mitigate some of those issues. So, you know, we all talk about a work-life balance. I reckon all of you have got a bad work-life balance. I think people who are attracted to this area, generally speaking, have that. And I know I'm certainly a very poor example of living life as we know that we should. But some of the other things that we're starting to identify is because of the degree of accountability that is being put on the emergency service responders at the moment, we need to try and ensure that there is some scope for things to drop off their workload. And we will, as a result of the Edith Cowan research, be putting a lot more emphasis on our managers and supervisors to actually get engaged with their people. And we'll talk later about a Know Your People campaign. But our managers are actually saying, if you want me to invest in this space, what is it that is going to drop off? Because it is not physically possible for me to look after wellbeing and also deliver on my key corporate outcomes. So we have a fair bit of work that we need to do there to try and identify ways that we can mitigate the impact on them. One of the other things that's come out of the Wellbeing at Work survey is that when we are looking at the workload that our people have, we can have some people who may be in charge of 90 staff, and we can have others who will only be in charge of one or two. The impact is not dependent on the number of staff that you have. It's dependent on obviously the number of issues that the staff you have. And we are finding that the increase in access to wellbeing services has been dramatic, and it is in large part through the success of MyPulse. So we can be very grateful, I think, that as a strategy for getting to know our people better and getting to understand where they are at, we are identifying more and more issues. That is leading to more workers' compensation claims. That is leading to more access to psychologists and mental health professionals. And it is clearly identifying to all of us within the agencies that we are a long way from reaching our plateau. And one of the things that I would sort of commend to you is, if you are looking at a preventive strategy such as a MyPulse, don't think it's going to drop your workers' comp, and don't think it's actually going to lead to anything other than an increase. Because the reality is there are a lot of people out there who are burying things and suppressing them, and programs such as this actually do lead to those issues coming to the fore. Just show a video in relation to Nick. So one of the things that I wanted to talk about with Nick, which I think is really quite remarkable, is that Nick, as a senior firefighter, was undergoing some promotional processes, and he was quite significantly impacted by the death of his mother. And he actually, to me, acted at a level that, is just so impressive, where he actually addressed the group that he was training with and expressed to them that because of what he was going through with his mental issues, he was unable to continue and complete the training. And, I've been around a fair while. That's almost unheard of in any organisation. And for them, then he to come up and actually have the courage to put it out to a video and to make it available to everyone to see is just an incredible credit to him. And we'll end up with about 20 lived experience videos that we're running, all focusing on different bits. Some people have got chronic pain, some people have got PTSD. The list is quite varied. But we know that that's how we will make a difference. And we also know that if we didn't have MyPulse, we actually wouldn't have had the funds to be able to develop the lived experience videos. We wouldn't have had a facility where we could host them, where they could be available, most importantly, to family members, not just to our people. And it's been a really significant step forward. A little bit later on today, we'll show you a video where we've actually got the leaders of all the emergency services making clear statements about what they think about mental health. And all of it was unscripted. So it's been a very positive thing for us to identify the best lived experience that we could promote. Now the really terrible stuff. I started my involvement with MyPulse as a member of the User Advisory Reference Group. And we worked slightly to the left of the Professional Practice Reference Group. The Professional Practice Reference Group was psychologists, allied health professionals, etc. And the User Advisory Group were practitioners such as myself, and also the unions. And it took a huge amount of effort and an incredible number of meetings for us to actually get agreement on what was appropriate from a professional practice perspective, and also what was able to be delivered from a user reference group perspective. Now, clearly, the unions, they had a particular interest in a number of things, the main one being confidentiality and making sure that there was no way that any of the information could track back to the department. And in addition to that, we needed to step through how every single process within MyPulse would work. So the end result is a 133-page document. That document specifies exactly what words are to be used when a coach makes a telephone call, and we'll talk about that shortly. It specifies what is to be said in an email if somebody goes green in a mental health screen, what's to be said if they go red in a mental health screen. It is a very, very complex process that has ultimately been agreed by all of the parties. And I can't tell you how complex that was, but I also can't tell you how valuable it was. Whilst it was a little bit frustrating on the way through and trying to address the various viewpoints that we all came from, it has ended up with a product that everybody was prepared to sign up to, and everybody was satisfied that the interests of the employees would be well served. Unfortunately, one of the things that happened about 12 months in was we needed to review the business rules and try and identify whether or not we'd had any departures or if there were any refinements that needed to be made. And I forget how long it took us to refine the business rules. And we have actually just sent them out to the unions, again, for the unions to be satisfied that the interests of their members are being properly catered for through the business rule development. Sam, do you want?
So with the mental health and the physical health screens, the mental health screen utilises the DAS-21, which is depression, anxiety and stress scale. It's a standardised scale. So we actually can, through data, look at how this cohort compares to other cohorts around Australia from a mental health perspective. It looks at symptoms and it's a way of our coaches being able to tap into each person through a standardized tool to then recommend, the particular coaching which would follow on. The physical health screen is something that we created in-house. So it's 45 questions and it covers the 5 areas of their history, their physical history, their lifestyle, the social aspect, their psychological aspect and their support mechanisms. When someone does one of these health screens, we use a traffic light system, excuse me. The traffic light system is easily recognised. Once again, we want to keep things very simple. And the traffic light system, they'll get a green, amber or red, depending on their risk factors. If they are displaying healthy well-being, mental health or physical health, they will come out green, which is great. It praises them for their healthy lifestyle choices or their mental well-being, and it promotes that they keep up what they're doing because, well done. They'll get a certificate, as I mentioned earlier, just to acknowledge that. If someone displays moderate or high risk factors, then they'll come out as an amber or a green. If someone comes out as an amber, through the business rules, as Matthew talked about, we've got strict processes in place, and our health coaches will reach out to that person within 8 business hours for someone who comes out as amber, or 4 business hours for someone who comes out as red. And that's to recognise that the level of severity of how they've actually self-answered those questions is obviously on a scale, and we want to make sure that we're reaching out to those people as quickly as we can. Through the authentication process, which I talked about a little bit earlier on, that ensures that when a participant logs into MyPulse, that we've got their correct email address. They also need to authenticate through their mobile phone. So they'll log in, it'll send them a text message to their mobile phone, which they need to enter a code into. They'll only need to do that once, but what that means is that if someone does do a health screen and come out as amber or red, that our health coaches have got their correct contact details. because we need to be able to make sure that we can actually reach out to those people who are needing us at that time. So we want to make sure that that's all authenticated. If someone does go through one of our coaching programs, and we have some very good opt-in rates, which we'll show you in a future slide, we use a coaching model. So I really want to stress that this is coaching and this is not clinical. Although all of our coaches are clinically trained, we take them on a coaching pathway. So for coaching, we use the GROW model, which you may be familiar with. It's very much goal-oriented, and it promotes accountability, and it looks what options that each individual has available to them, and then sets a goal, and then our coaches will meet with those people, regularly to check in and see how they're going on those goals which they've set for themselves. I can put my hand on my heart and say that our coaches are brilliant. We get amazing feedback about our coaches, and we've got a few comments from some participants later on, which I'm sure you'll be impressed with. I think that's all I wanted to say on that one. Thank you.
So just quickly, we're now getting into a little bit more detail around some of the screens that we do and the outcomes of them. So far, we've had 164 cancer risk assessments done. As Sam mentioned, they are online. You can see the breakup there between career firefighters and volunteer firefighters, so it's around about 50-50. And you can see the number that have gone amber and the number that have gone red. Now, if people go amber or red, they will get a phone call from one of the coaches, and the coach will then make some suggested recommendations to them about directions that they can go to try and confirm whether or not they actually are at significant risk. I personally think that this is one product that we need to go back to the drawing board on. I think that we need to focus more particularly around our 12 presumptive cancers, and at the moment it's quite generalist in nature. So that's my desire, and we do need to frame it up and I think completely redevelop it. The other thing, of course, that we need to be mindful of is when people go red, for example, one of the pieces of advice that they will get from the coach is to make an appointment with their doctor. But when they get to the doctor doesn't quite have enough information to be able to progress things, and they're starting from scratch. So I think this is an area that we need to step back, start again, and have a more fulsome look at the direction. There is one question, Anna, if you could just. Yeah. Yeah, so the question is, have you identified any barriers to people accessing MyPulse? We have identified a number of barriers. I'll talk about some of them shortly, but one of them is actually a technical barrier. And the technical barrier relates primarily to our volunteer firefighters, because our volunteer firefighters have a VDOT fire address, and unfortunately over time they actually don't access it, and they've forgotten their passwords, and they don't know how to access it. And so we've actually had to try and develop a workaround so that somebody in our office now is able to reset the passwords for the volunteers, but it has been a really significant limitation and something that we actually didn't contemplate at the outset.
So our health clinic consultations, this is where we go around the state with a team of our health coaches, and we run health clinics. So they're corporate health type clinics. We look at a range of measures such as blood glucose, cholesterol, blood pressure, their height, weight, and BMI. Each consultation is about 20 minutes with a health professional. We make sure that they not only take these metrics, but they explain them to each participant and how that might affect them now and into the future. In the last 2 years, we've run 30 clinics across the state, covering 19 different centres statewide. And we've delivered over 500 health consultations. So those are the 20-minute consultations. For our Tas Fire Service firefighters, as part of that consultation as well, then they can have a lung function test or a spirometer test, which is particularly important for our firefighters. And that comes in as part of the health consultation. The idea of these is that our emergency service responders are all busy. Our volunteers, have day jobs as well. And then they do the firefighting on the side. And not everyone can take the time to go to their GP and just have these, these health measures checked up. By no means does our health clinic consultations take away from a GP visit, and we do encourage all participants to go and visit their GP regularly. But this is just about once again, making it easy for people that we go to them and offer this free and confidential service. Through the health clinic consultations, a number of people have, it's been identified, they've got, elevated blood glucose, for example, and then the recommendation is they follow that with a GP visit to get a more in-depth analysis from their health professional. Right, next slide, please. Back to you, Matthew.
So as you can see here, we've had over 1,500 screens done. We have a particular way of counting them under the business rules. It takes about 10 pages to explain how we count them. But suffice to say that we've had 948 individuals do one or two of the screens. So we're very pleased with that number, given that we had a gradual way of introducing people to it. We need to work a bit harder with our volunteer uptake, but we are quite pleased with the number of people that have come in. Now, of course, one of the things that you need to do when you are trying to cost a program, and this is completely free for all emergency service responders, so the department picks up the bill for the coaching sessions and for everything else, is try and identify what our risk level would be so that we could try and forecast our budget. What we did there was we identified that worst case scenario, taking into account normal industry standards, we would have 60% of our people go green on the physical health screen, 60% go green on the mental health screen, 30% would go amber in both, and 10% would go red. So that was our calculations. Within a month, we were nowhere near that. And 2 years later, the numbers haven't shifted at all. So if you could go to the next slide. So instead of 60% green in the physical health, we have 4%. Instead of, sorry, we're closer obviously with the amber, but the red has been really significant for us. In the mental health, it's a little bit closer to where we were expecting it to be. But one of the things that this obviously meant, and as I say, this was 1 month in, 6 weeks in, we knew that these numbers were our numbers, and we had to go back and completely recost the program and identify what our exposure was likely to be. So we got all of the leaders of the emergency services in. We briefed them on where we saw our risks were. But we were also able to identify a couple of really important things. And one was the underreporting that some of the emergency service responders were doing. And that underreporting actually led to the leaders saying, we'll just wear the budgetary impact. We would rather pick someone up from underreporting than change the algorithm and actually miss the opportunity to pick that person up. So it was a very, to me, a very profound statement from the leaders. And so we actually have not interfered at all with the algorithm. And the net effect of that, of course, is that more people have been entitled to coaching, which has been a fantastic thing. But there are a few other aspects of people's reluctance to take up the coaching, to take up the screens. And I'll just give a couple of examples. So the first example is my own. I did the mental health screen and the physical health screen, and I got my phone call 3 hours and 59 minutes. So I knew I'd gone red. I also knew the script, and I was still quite stunned at the quality of the phone call. It took about 40 minutes to walk through all the issues. And the thing that got me was that I went red on the physical health. And obviously I'm an athlete, so I was quite shocked that was the one I'd gone red on. I was pretty sure it'd be the other one, but there you go. But for me, it was, well, how can it be? You know, I was quite resistant to the fact that I could have gone red. But a colleague of mine went red on both. And her attitude was one of complete subservience to the process. And she said to me, I knew my life was wrecked and now I've got the evidence. So the way that people respond is obviously going to be very individual and very situational. For me, I was not offended, but I was prepared to have a bit of a go. And then I went through the coaching process and was absolutely stunned at the quality of the coaches. She did the same and was very satisfied with the outcome. But there was another gentleman, a very senior police officer, and he was in significant distress. And on a Saturday, I drove to where he is in the state, and I said, you need to do MyPulse. We've been talking about it for months. Things aren't going well. It's time for you to do it. And he said, I can't bring myself to do it. I just can't bring myself to do it. I said, okay, you sit next to me and I will do it on your behalf. So we did the DAS and then we did the other 45 questions. He clearly was going to go red on both. And at the end of it, he said, is that it? And I said, yeah, that's it. He said, so I've stressed about this for months and it was as easy as that. So we've got quite a lot of competing thoughts that we actually need to deal with. And so out of that one experience with that senior police officer, we now try and encourage our wellbeing support officers to sit next to their clients and actually fill it in with them to try and mitigate that significant concern that they had. And I've been a little bit surprised at the extent of it.
Just a couple of coaching statistics. So the first one is participants who are opting into coaching. So they'll go through the mental or the physical health screen, you know, fill out the tools. If they go amber or red, then that opens the door, their eligibility, I guess, to opt into coaching. Not everybody does. It's personal choice. We don't enforce it in any way. We do encourage people to opt into coaching and really promote the privacy and the confidentiality of the coaching process, and that none of the information discussed or even that they've attended a coaching session or completed out the survey would ever make its way back at an individual level to their manager or to the department as a whole. For red participants, we get 73% of people who decide to opt into coaching, which we're really proud of. We're never probably going to get 100%. For amber participants, it's 24%. Now, although that may sound a little bit low, as Matthew mentioned, the buckets to tip people in to opt into coaching are, we've lowered them slightly because we do want more people to have the opportunity to opt into coaching. So when our coaches reach out to AMBER participants, it could just be a couple of factors in their lifestyle or about them, sort of their mental wellness that has actually tipped them into the AMBER bucket. But through that conversation, they actually might decide that they're travelling really quite well. They've got things in place to manage their mental health and physical health and wellness, and that coaching might not be for them at that particular time. So even though 24% does sound quite low, we still are actually really proud of that. So for AMBER participants, I'm not sure if I mentioned earlier, but they get 3 coaching sessions with one of our qualified coaches. They're 45-minute sessions. And for our RED participants, they get 6 sessions and they're 60-minute sessions each. So it's quite comprehensive and that can span across several months as well. So what we want to do is, as I said, set those goals, but then leave the participant enough time to actually go away and work on those commitments that they've made with the coach. So when they come back for their next coaching session, they can check back in again. What we don't want is that they have 1 per week, because obviously that's probably not enough time to work on those factors, especially with physical health, because to change your physical health can take quite a while to lose weight or improve your physical physicality. For the average number of coaching sessions, our AMBER participants come out at 2.4. As I said, they're entitled to 3 coaching sessions. And for our RED participants, it's 4.2. We would love everyone to use their full allocation of 3 and 6. Some of the feedback, or the most common feedback that we get, is time. People's lives are busy, and as I mentioned, especially with volunteers, they're effectively doing 2 jobs, and balancing, kids and everything else that goes on in people's lives. So getting to that full component is not always easy for people, or as they go through the coaching process, they might get to the 5th session and actually feel that they've now got some additional tools and mechanisms that they can use in their life, and they don't feel the need to go on and finish that next session, for example. But we're quite proud of those statistics. Next slide, please.
So just as Greg's coming up, one of the things I think it's important to say is, as Sam mentioned, it's the 3 and the 6 coaching sessions. Both of them are done over a 12-week period. So that's obviously the intent is to change habits over that period of time. And people are able to do the health screens anytime they like, but they can access the coaching sessions every 2 years. So we're now at the 2-year mark, and we're having people who are coming back in looking at getting additional coaching sessions as they move forward. Greg.
Thanks, Matt. Thanks, everyone. It's great to be here. In fact, I'm asking myself the question why I'm actually here and how did I get to be here. I'm actually on leave, so I got a phone call from Matt a couple of weeks ago, and he said, "Look, we've got this masterclass happening, and I'd like it if you come along and spoke to the group." Matt's a very hard person to say no to, in a nice way, but anyway, here I am. Look, it's difficult to stand up here and talk about yourself, so I'm not going to talk about my life or talk about war stories, but I'd like to share my experiences of MyPulse and my journey over the last year or so with that program. To put it into some context, and I did write some notes, so I didn't forget most things. Put it into context, I joined back in 1987 as a recruit firefighter. So I've been a firefighter for over 35 years, and half of that was on the trucks, so responding to incidents and doing all those things. And like all our career staff and volunteers, we see lots of bad things, and they do have an effect on mental health, etc. However, there are some things over and above response that, as you go through the ranks, you are exposed to outside of operations, and they're those things around human resource management, change management, and all those types of things. So my role for the last 5 years has actually been as the Assistant Director for Operational Training, and I look after all the career and volunteer training across Tasmania. So to put that into context, I actually look after the training for around 5,000 volunteers, of which Andrew is one, and about 350 career staff. And that's from the time they roll up and sign the paperwork right through to pretty much the end of their careers. And our agency's been going through some significant change, and there were areas there that I personally had struggles with, and I didn't actually know what was going on. I became a little bit withdrawn, and I've got a little microbrewery that a lot of people know about, and I actually found that I was drinking more than I probably should have been too. So it was some time into that journey. My wife said, "You need to talk to somebody." So I approached my doctor, which most people would. I wasn't aware of MyPulse at this stage. And my doctor said, "Look, I think you need to talk to a psychologist." So she set me up with a psychologist, and I spent a few sessions with her, and that was terrific. One solution she did come up with, was that I should retire, which is probably a little bit out of the realms of, or a little bit too far away from me at that stage. It's a little bit closer now. But I found that whilst it was good, the psychology part of it wasn't meeting my needs, certainly at that stage anyway. Now, I was a little bit sceptical. I'd heard about MyPulse early on, and I was a little bit sceptical, I'll be honest. And it wasn't until a little bit into the program that I decided I'd have a look at it, and I've done all of it as well. And it's no surprise, I guess, that when I did the mental health part of it, I actually came up red, which surprised me. No, not. And then what happened was, incredibly, I had a phone call from a coach, and she went through a whole lot of stuff with me, which was quite in reflection, it was quite moving, I suppose, for want of a better word. Now, she reached out to me, which was terrific, and we set up for me to talk to her over a period of time. We had, and as Matt's already explained, I had 6 sessions with her and Dominique. I think she's probably watching now. She was terrific. So over that period, as has been explained, it was more a coaching session, and I found that more beneficial to me from my background than a psychological perspective. So it was more about her explaining to me why I felt like I did, and giving me strategies around how I could improve the way I was working and the way I was thinking. Strategies around how my thought processes were actually a little bit self-destructive, and how I could actually address those things. So we worked through a lot of that. In fact, it's a long time since I've been to school, and a long time since I've had to study. She actually gave me homework, which was quite a bit of a surprise. So she held me to account. So there were things I had to go away and do, and things that I had to work through myself, that and then come back to her with where I'd got to and what the answers were to some of those questions. So it actually made me work towards changing my behaviours and the way I was doing and thinking as well. Ask any questions as we go along too, if you like. Look, my initial meeting, I was still a little bit sceptical, and it was amazing how the coaches made me feel through that initial phone call that I wasn't, there wasn't something wrong with me. That was there was someone there to help, and it was unusual for us. I grew up in an era where I think Nick said, if you put your hand up and said there's something wrong with me, they'd say you're weak. And that's how firefighters and I guess a lot of first responders and Defence Force personnel were treated way back in the late 80s. So I found it quite comforting that somebody was actually listening to what I had to say. Our initial meeting was one where we established a relationship fairly early on, and it was terrific to have somebody that was there to listen to some of the issues that I was going through and some of the personal things that my wife and I in particular were struggling with around work. So from that part of it, it's been a godsend. I think I'm not quite sure where I would actually be, whether I would be retired or whatever, but she's been terrific with bringing me back on the straight and narrow. The other thing about it is that, yes, I'm at the age where I am going to retire in the not too distant future. So she's been working with me about transitioning to retirement as well, so initially it was, you need to retire to get away from it. Whereas this is more about helping me transition into a retirement where I want to go, not that I have to go. And I found that extremely beneficial as well. You know, you wear a uniform, you're very proud of that uniform, you are focus of community, etc. And for some people, it's very hard to move away from that. So she's been doing a lot of work with me around that as well. And just so if my boss is watching, I'm not ready to retire just yet. Look, I've been a great advocate for a little while now about this program. Initially, as I said before, it was I was very skeptical. I'm a great advocate for it now, and that's why I'm here after Matt asked me to come. And I just wanted to share some of my experiences about what I've done with this over my journey. And I would encourage anyone within my agency and within the department to do exactly the same thing, and that is get online, have a look to see how you're physically and mentally going. From my perspective, it's been outstanding, and I couldn't thank MyPulse and the department for what they've actually done for me over that journey. I'm still going through it. I think Dominique, she checks in with me. She still tunes me up every 6 or 8 weeks, which is terrific too. But overall, I'm in a better space now than what I've ever been, and it's changed me, I think, for a better person. So.
So look, I'm now mindful of time. We'll just run through some of these, but not all of them. I think the top one is incredibly important. We have a completely different lens into the department now, and it has given us an opportunity to identify things that were there to be seen, but we weren't seeing. And so that has been incredibly important. The coaches actually come to us with de-identified information, and they actually will list some of the issues that are occurring within certain pockets of an organisation, certain geographic regions. And that's been incredibly beneficial, and it actually allows us to scope up some of our training into the future. Stigma remains an issue. That's why we've done our lived experience videos and a whole range of other things that we'll talk about later on today. Nutrition in the workplace. When I started on the user advisory reference group, they gave me snow peas. So they're obviously across nutrition. But in other parts of the department, like the police academy and the radio room, there is an abundance of food and none of it is snow peas. So, you know, we are starting to identify that there are some things that we need to look at in that space as well. We have a major undertaking to increase wellbeing literacy, and that is a significant part of the next 5 years of work for us. And I think this last point is very valuable as well. We've got so many people that are negative about every aspect of life, and they drag us all down. And the reality is we actually need to flip that and look a little bit more for those who actually give us optimism, because they're the ones that we should be surrounding ourselves with. I mentioned underreporting. 61 of our AMBER participants through that phone call escalated to red. As a business process, that phone call is incredibly important. There's a range of other things in the business processes. If somebody is in crisis, they don't get coaching, we suspend the coaching whilst they deal with the crisis issue. Virtual learning, the general view amongst many emergency service responders is if you can't be bothered coming and talking to me, don't think I'm going to look at anything. And so that's been a big thing for us. So we need to step away a bit from virtual learning. And as we set up at the start, the access by the volunteers came in late. Volunteers have got different needs. We need to rescope that and make sure that we're in a position to deliver the services to them at the times that work for them. So there's a little bit of work that we need to do there. And also leadership actually makes a difference. We will have Dermot who will go out and say that he's done both screens. As soon as he says that in a workplace, bang, people will do it. We've got pockets all over the state where one person is the person that makes the difference. And that's been really important for us to understand. The attitude that we have is that MyPulse is a game changer. What it's done for morale with people being able, when they're not in crisis, when they haven't been at a fatal crash, when they haven't been at a fatal fire, to be able to access a really comprehensive coaching support service free of charge to set them up for the future, it has just had a mammoth impact on the morale and the commitment that people feel towards the agency and also to their colleagues. Sam has mentioned about this differential between coaching and counselling. Coaching doesn't work for some people, but we are finding that it works for an incredible number. And we do find that the emergency service responders, as Greg mentioned, are very, very interested in being accountable. And that has paid great dividends for us through this process. The other thing is we can't rest on our laurels. We must continue to redefine everything that we're doing in this space to make sure that it is fit for purpose. The big trick for us has been to make sure that what we write for the Tasmanian emergency service people, because they actually aren't that keen on reading about the general public or the general population. Now, the other thing I did mention earlier on that we have had a number of workers' compensation claims that have come in. In addition to that, we've had 46 people referred from MyPulse to psychological support, which comes in through Wellbeing support. And that is a great number of people that we have been able to pick up that we would not have had access to previously. The other thing that we have been doing, which has been important, is we will provide 6-month gym memberships for people if the coach tells us that they think that they would benefit through a physical exercise program. That again is not something that we'd originally set out to do, but it's something that we've added in as it became evident to us that that was something that was going to be very valuable to people. I won't speak to these, but we'll just cycle through. I think there are 5 of them, sorry. Just the perceptions that some of our people have had, and we've noticed that there has been one person on Slido say the same thing. And these are really important. So this is the United Firefighters Union president for Tasmania. And it's incredibly important for us to have the total support of the unions as we step forward in this. So I'm really impressed that Mark is actually also prepared to talk about his own personal experience as a way of promoting it. And the next slide is somebody that from time to time I'm in conflict with, the president of the Police Association. And I love the fact that at the outset, when he was on the user advisor reference group, he thought it was too good to be true. But with the experience of 2.5 years, he now knows that it is true and it's as good as he thought it was. And I'd like just to hand over to Andrew As you can see, Andrew from the Georgetown Fire Brigade and also president of the Retained Volunteers Association.
Oh, good afternoon. You're going to be late for lunch. Thanks, Matt. Thanks for the honour of being up here today. And I represent 600 volunteers in round figures, but we're 5,000 volunteers strong in Tassie. And I have 32 members in my brigade in fire, and I have 14 SES members. I'm 38 years young in my career within the fire service and within the SES. So that full gamut of exposure, my team and myself have been exposed to over that 38 years, and 25 years previously in ambulance as a volunteer. And those of you knowing regional areas, you have a paramedic and a volunteer or a full volunteer response. So there's not much we haven't seen as part of a volunteer cohort within the Tasmanian Fire Service. Matt's mentioned, and I thank Matt for his kind words at the start. So fortunately for me, I don't have to be political. So I go and kick some butt and say, you haven't given us enough money. What the bloody hell's going on? That was a 4-page paper, which I'll deny, but Matt certainly, and the former Dep Sec in Donna Adams, who's now Deputy Commissioner, assisted me with writing, I suppose, with some facts and some statistics. It wasn't hard, you know, this all works off relationships. And I think no matter where we go through in life, if we've got positive and effective relationships, we can turn anything around. And I think that's what's so important with the collaborative approach that we as an association have had with DPFEM, and particularly with Matt, fostered through the DepSec, but also being empowered by my association to actually really, I was going to take someone out if they didn't give us access to this MyPulse system. We've had CISM, and many of you have got something similar, peer support process, fantastic. We started with wellbeing support, fantastic. But the $1.5 million was never going to be enough. Double it, triple it, quadruple it. So we got there, and to that end, we are working through, and we're way not there yet from a volunteer cohort perspective in getting fantastic access, but we have got access. And some of those volunteers that you've seen, that's heartfelt, their stories. In the 32 members I've got, every week we have training. We have 2 things we talk about. One's diversity. One's about inclusion. As part of that diversity, what does it look like? How are we travelling? How are we behaving? And that's come about because of some very not appropriate behaviours by members of my team, led by me. That was something I'm not proud of. Not that I was aware of it. That's no excuse. The second part is now voluntarily people are talking about MyPulse. You need to really see that experience that's shared with 30 members, 30 volunteers from all walks of life. Whether it be the unskilled, real literacy and numeracy issues, to the manager in a department, in a business. Oh, Chief, by the way, I went red on my MyPulse result. Shit, really? Oh, how are you traveling? This is in front of 25, 30 people. I mean, it's the environment that we create that allows our people to blossom and ultimately share their experiences. And since that time, it's now commonplace conversation within our teams. From an association perspective, though, we've got brigades, we're fostering brigades, and through better education and more information getting out from the department, we'll increase that number. I know we'll increase that number. Of 2 brigades, both mine and one other, there are 3 people currently on a mental health care plan. That's no mean feat for 3 people that were dodging along in the last 12 months thinking everything was okay. You know, that's what this impact has had within the volunteer cohort. It's profound. Yes, we may redefine it. Yes, we may do things differently into the future. but it's, I suppose, the capacity for us to constantly review what we're doing, why we're doing what we're doing. We're not the 1980s. My first fatality, those of you in the industry, I was frog marched to go and have a look at the scene. You need to learn this, boy. That's the truth. That's not how it is anymore. And it's so great that it's not like that. But we've got MyPulse. We've got fantastic resources. Yes, I've been through it personally. I didn't get reds. I'm really asking myself, did I tell the truth? Based on what everyone else tells me. And I've had some experiences in the last few months. I probably need to do it again. But look, all I can say is, you know, if you can go and buy a MyPulse or a version of it, make sure it's inclusive for the volunteers. Matt knows the difficulties with the access and with the lag. That's not beating anyone up. We've learned from that. You can't make that same mistake because you've been told now. So in all seriousness, you know, it's heartfelt thanks to the department. And Dermot's relatively new to our business, but our organisation has been very committed to MyPulse, and without the personal support that I've had to really push and foster MyPulse within so many volunteer cohorts and volunteer meetings that I participate in, you know, probably wouldn't have the participation, but the organisation is now carrying that can as well. So it's making a huge difference. And I know that there's some people really struggling in my little brigade, but I know they're much better for it, and they're going to be in a place of control compared to where they were 18 months ago. So yeah, can't speak highly enough about MyPulse and what it's doing and what it will continue to do. Thanks very much.
And so just to conclude with, sorry, would you go back just one? Sorry. This is the Prospect Fire Brigade, and we went and gave a talk about wellbeing support and some other things. And they also had a group called Speak Up, Stay Chatty that was present for that night. And we left, and unbeknownst to us, they all committed that every single operational volunteer would log in and do MyPulse. They then identified that our business rules didn't give them a coaching completion certificate. So now we do. It was really thrilling to see that there was momentum that was generated from within. There was a commitment that was from within, and people actually saw that commitment through to fruition. Of these people, the ones with the certificates, about 6 or so, actually went through the coaching program. So not everybody ended up in the coaching program, but just incredible commitment, and we were thrilled to hear it. That's it for us for this session. I know that we're sort of running a bit late, and I think we need to go to lunch, but very happy to take any questions over lunch. Thanks.
All righty, we will start with the afternoon session. So good afternoon. My name is Maree Riley, and I'm an organisational psychologist with the Australian Antarctic Division. I've been involved with the Antarctic program since 1990, and I've been on staff as a permanent staff member at the Antarctic Division for 10 years now. And in my role, I've had that opportunity to spend time on our Antarctic research stations. You might be wondering, in the context of today's conversation, why we're talking about the Australian Antarctic program and wellbeing in Antarctica. Matthew and I talk quite regularly about our respective workplaces. We compare, we contrast, we talk about what's going on in the wellbeing space in our different areas. And I certainly learn a lot from having the opportunity to talk to Matthew about what is happening in the world that he works. And I hope Matt also has the opportunity to learn from me as well. It's absolutely invaluable to step outside your space, to have a look at what happens elsewhere, to provide a little bit of context to what you are doing. So my aim today is not to compare what we do in the AAD to what you do in your respective services. You might find there's some things that sound familiar. You might find things that are completely out of context for you. But the intent is just give you a little bit of insight into our world and the things that are important to us. So I'm going to spend an hour or so with you this afternoon, and the sort of things I want to talk through is firstly, just to give you an overview about the Australian Antarctic program, just to brief you in a little bit to the world in which I live and work and support. I then want to talk a bit about the psychosocial challenges of what's known as an isolated, confined and extreme environment. That acronym is quite appropriate when you think about Antarctica. But an ice environment is also something that is used to describe a submariner environment, space stations and that sort of area as well. And in fact, the work that we do with the Antarctic program, it is an analogue to space. And so a lot of research that happens in Antarctica is about supporting and preparing humans for extended space travel. I want to talk about the work that we do to promote positive mental health and wellbeing in our environment, talk about the support channels that are available to our expeditioners, and then just finishing off, and again, very relevant to this context, talking about how we manage critical incidents in an Antarctic context. And I will show some pictures on the way as well to give you a bit of insight into my world. So to start off with, Antarctica and Australian Antarctic research stations. So where are we situated? We have 3 permanent research stations on the Antarctic continent, Casey, Mawson and Davis, obviously named after explorers from the heroic age of Antarctic exploration. We also have a permanent year-round research station on Macquarie Island. And then we have a summer-only station at Wilkins Aerodrome, which is around 3 hours from Casey Station. It's a long way away. So most of our travel, particularly to Mawson, Macquarie Island and Davis, is by ship. And you can see there a bit of the indication of the times that it takes to get to one of our Antarctic stations. So to go to Casey, which is our closest, we're talking 7 to 10 days on a ship to get to the continent. In 2008, we introduced an air capability, and that has made Antarctica far more accessible. So we can now fly from Hobart to Wilkins in around 4.5 hours. And that's really allowed us to do so much more in the Antarctic context. It's allowed for so much more science to happen. People will be able to go in much quicker than spending 7 to 13 days plus on a ship getting to and from Antarctica. So that's the world that we live and we operate in. And we are very proud, Noinya, which is our new icebreaker that came into service late last year, that is very much part of the Tasmanian Wharf community. She is an amazing scientific research vessel that we are exceptionally proud of, and is really going to support Australia's scientific interest in the Antarctic area and the Southern Ocean. So living and working in Antarctica. So the duration, the population and who we employ. So the numbers that we have on station differ across the season and also which station they are located at. So our smallest stations are Macquarie Island and Mawson. And over the summer, they'll have a population of around 25 to 30 people. Over the winter, that population can drop down to about 15 people that are living and working together for an extended period of time. At Casey and Davis, which are our larger research stations, that summer population get up around 80 to 100, but drop round to about 25 over a winter period. And then Wilkins, we have 8 people at Wilkins over the summer. So that population expands and contracts depending on the time of the season. And that in itself has an impact on the wellbeing of that community. We send people to Antarctica for up to 15 months. So the majority of the people that we send south over summer are there for around about 4 to 6 months. But those that go south for a winter are there for generally 12 months and some after 15 months. So that's 15 months, 12, 15 months living in this isolated, confined and extreme environment. And that can be extended. In response to COVID, we had to extend one of our stations, Davis, in Antarctica, for over 500 days. And this was a small community of 25 people on station for over 500 days. That's a very long period of time. And who do we employ? Well, the Australian Antarctic Division, we employ our own staff, and their role is primarily about maintaining these stations over the season. So we employ a station leader, a station doctor, we have support staff, chefs, field training officers, ICT specialists, supply specialists, but most of our workforce is made up of tradies. So we employ sparkies, we employ electricians, boilermaker, welders, carpenters, and that often comes to a surprise to people, because when you think about working in Antarctica, we often think scientists, but there is a whole population that actually supports the delivery of sites. So our workforce, tradies and station support. We also employ Bureau of Meteorology staff on all of our research stations. And then Macquarie Island also includes Tasmanian Parks and Wildlife. Macquarie Island is part of Tas and it's managed by Tas Parks. We take South Arts Fellows doing a whole range of different arts projects. And then obviously critical is the Australian Science Program participants. So we have scientists and researchers from across academic institutions, domestically and internationally, that will travel south to undertake science over the season. I refer to the term expeditioner, and that's what we call all the people that participate in the Australian Antarctic program. And it's that historical aspect of expeditions going south, but they are all known as expeditioners. I often get asked, what's a station like? Oops, I'll go back one. And the best way that I would describe a station is like a small town. There's a main road that goes through this little community. And in this community, we will have living accommodation, we'll have a gymnasium, we'll have site services, we'll have workshops, and we'll have scientific labs, we'll have an administrative building. But to a large extent, it does replicate that little small town concept with everything sort of located up the main street. And all our continental stations look pretty similar to this one, which is Mawson. And then Macquarie Island, she's affectionately known as like a farm environment, just with her buildings, and she's absolutely beautiful, with some work being undertaken now just to upgrade some of those facilities. So what are the challenges? As you can appreciate, there are some clear challenges of living and working in this type of environment, some clear psychosocial challenges. There are social challenges for our expeditioners. They are geographically isolated from their normal lives for an extended period of time. The location is challenging to get to. It's not a quick trip to go south. Their world is confined. It's confined to a small number of buildings where they are living and working. Now, COVID has given all of us a slight taste of this, or what it's like to live and work in a confined space, to be isolated in your home. But I'd ask you to magnify your experiences to what that would be like over a 12 to 15 month period of living in this confined setting. Antarctica is a big continent, but our expeditioners are confined to a very small space, given the environmental conditions they are living and working with. There is camaraderie, but it's forced togetherness to some extent. And there is a lack of privacy. There is very few places that you can go to have privacy on station. Your room is probably the most private space that you will have. If you want to leave the station limits, you must go with somebody else. So not having that sense of me time is something that expeditioners often talk to. It's a diverse group. We joke about this, but where else would you sit down to breakfast with a Sparky, a world-renowned climate scientist, a doctor, and a journalist, as an example? So the expeditioners are living and working with a diverse group, and it may not be a group of people that they would normally choose to spend time with. Again, we joke, but we choose your friends for the next 12 months of your life. We choose the people that you are going to be living and interacting with. Another challenge for expeditioners is that lack of separation between work and non-work aspects of their life when they are living and working in this same space for an extended period of time. And monotony and boredom can come in as well. Expeditioners often describe it like living in a bubble, where things can become magnified, where there is little context outside of the world that they are living and working in. Separation is probably the biggest challenge for our expeditioners, and particularly that separation from their intimate partners. If there are issues that are going on at home, it can be really challenging for an expeditioner to respond to them. They're not there physically to provide that support. There can be a sense of helplessness about not being able to respond and provide support to issues that are happening at home, a sense of frustration. And we've certainly seen that over the last couple of years. Expeditioners in Antarctica who've lost their homes to bushfires, expeditioners in Antarctica whose family have experienced the flooding that we've seen around Australia, expeditioners' families at home contending with COVID. While the world was contending with COVID, our expeditioners were probably in the safest place on this planet and did not have any exposure or any experience to it in the very early period of time. The other thing that expeditioners often talk about is that their family and friends don't have a shared experience. So it's really hard for their family and friends to relate to what they're experiencing in this Antarctic context. So when issues are happening on station, it's really challenging to reach out to family and friends and talk about what's occurring. Time differences, maintaining communication, managing poor comms on station are all challenges that expeditioners talk to as well. I'll talk a little bit later about comms. We have fairly good comms, but comms can go down and family may not be able to contact an expeditioner, hopefully just for a short period of time, but they are very reliant on the communication channels that we provide. And another significant challenge, which I will talk to more later as well, is about that return home, that transition home back into your normal life after an extended period of being in that station environment. From the environmental challenges, Antarctica is beautiful, but she is also dangerous. And so for expeditioners in this environment, there is potential concern of injury or illness, particularly noting those distances from Australia and the fact that if you were to experience an injury or illness over summer, it could take some time for us to be able to repatriate an expeditioner. And in fact, over winter, we can't. We cannot access our stations generally between April through to October. We can't operate our air capability because of the ice conditions. We can't get ships in, again, because of the ice around the continent. So our expeditioners are very much in Antarctica for that period without any ability to repatriate them. Expeditioners talk to that impact of the change in light-dark cycles. So summer is 24/7 sunlight. Winter, there are 6 to 8 weeks of twilight to darkness. And that has an impact on circadian rhythms, which in itself has an impact on wellbeing and mental health as well. And there are challenges of living is what is the driest, the windiest and the coldest continent on Earth. And so there are environmental challenges for our individuals of living and working in that environment, alongside the risk of cold weather injury. And the other challenge that expeditioners often talk to is that of the occupational challenges. Depending on the role that they are in, their tempo may change over the year. There may be periods of really high activity, periods of low activity. The weather, the environment can impact on people doing their job. If there are blizzard conditions outside, they may be confined to the inside world for 2 to 3 days, which impacts on their ability to go out and do their job. Expeditioners in certain roles, are on call. If a powerhouse goes down in Antarctica, that's pretty serious. And so they need to be responsive to alarms and being on call and things that might be going on station. We tend to find that expeditioners are far more autonomous in their role over winter when there are less people on station, and they need to ramp up over summer when more people come into that community. And while a lot of work goes into planning and resupply, if something is forgotten, you can't just go to Bunnings and pick something up as well. So those resourcing deficiencies are things that expeditioners have spoken to. And as well, the potential for critical incidents that I'll talk to separately in a moment. And what we find is that this can change over the course of a season. And this has that impact on the expeditioner wellbeing. So as expeditioners are preparing to go south, and they can spend up to 3 months in Hobart undertaking their pre-departure training, their tempo is gradually increasing, as is their excitement and their morale, and it's all going up. And then they find themselves on station and it can be a little bit overwhelming. It's all new. So again, a pretty high tempo as they are adjusting to living and working on station and becoming familiar with that routine. And then over the season, they do fall into a little bit of a routine. And sometimes people describe it as falling into a little bit of a rut. And what we find during that period is that when they do get into that little bit of a routine, often it's after our midwinter period, and the next thing on the calendar is coming home, there's a fair bit of gap in that time period, is expeditions often talk about focus becomes a little bit on me and less on we as the team. We can see a little bit more interpersonal tension arise in the community. Expeditioners often talk to experience symptoms of seasonal affectiveness disorder during that time as well. So those sort of things can have an impact on their wellbeing. And we know that's a period of the season that we need to be particularly alert to how our expeditioners are travelling. And then in that preparation for returning home, tempo goes up, cohesion goes up, morale goes up. And it's quite incredible when you talk to expeditioners about a period of darkness, that first ray of sunlight over the horizon, just the impact that has on their morale and their well-being is incredible. This model is not particular to Antarctica. You know, it's something that we see in military deployments as well, something we see in many contexts, and we refer to it as a third quarter syndrome. But you do see a change in tempo and a change in morale and that potential impact on well-being of that expeditioner cohort. For families, it's a little bit different. So what we find is that families grow in confidence over the season. They are used to their loved one being away and the demands are less on them than what they might be on the expeditioner cohort as well. So I want to have a little bit of a chat around what do we do in our communities to promote positive mental health and wellbeing. And there are a range of things that we look at the individual, the group, and the organisational level that we know can have a positive impact on our community. One of the key things for us is about understanding the risk and the protective factors for this population. I spoke earlier about some of the psychosocial challenges. That's one aspect of it. But also, what are the risks for the individuals? It's really important that we understand those and we understand how they can impact on somebody's effective adaptation to an Antarctic context. So what are the risks for our expeditioners in not adapting and potentially developing concerns from a mental health and wellbeing perspective? An individual who has poor social or interpersonal skills can struggle to adapt into this environment. Somebody who has a history of maladapting coping strategies in response to stressors will find it challenging in responding in an adaptive way to the stressors that they are going to experience on station. Somebody whose motivation is inappropriate. Somebody who wants to go to Antarctica to run away from a job that they don't like or to run away from a relationship that's not going well is not sufficient to sustain them for the challenges that they will experience in Antarctica. Lack of support from significant others. We often talk to when expedition is going south, they will comment, I am being selfish, I'm leaving my family behind to go and have this most amazing experience. And if the family isn't supportive, they don't have that support, that can impact on them significantly when they're in an Antarctic context. And the other thing that we see that can be a risk factor for our expedition's effective adaptation and their wellbeing is legacy thinking. Expeditioners who've been involved in the program potentially for many years, who think that we've always done it this way and we're always going to do it this way, and are not necessarily open to new ways of doing things. And when we are changing our program, which we are, it's a program of continual evolution, legacy thinking and that resistance to change can really impact on the wellbeing of this population. So what are the protective factors? What are the things that we know support positive mental health and wellbeing for our expeditioner community? Resilience. Individuals who've demonstrated that they are resilient through the challenges that they have experienced in their life. Expeditioners have realistic expectations of what they're getting themselves in for. They're not going south with rose-coloured glasses on thinking they're going to spend all their time out looking at penguins and icebergs and that it's going to be a bed of roses. It will be tough. And as part of our preparation of our expeditioners, we talk to them about the challenges. We talk to them about there are going to be bad days. There are going to be tough times. It's important that you're aware of these and therefore you're better able to respond to them when they do occur. We need our expeditioners to be flexible and to be adaptable. Things change very quickly down south, and we often term or talk to the A factor, the Antarctic factor. What you plan to do when you get up today could be totally different as the day progresses, because there are things like weather that impact on what we do on a day-to-day basis on an Antarctic station. Having a stable, supportive domestic situation is a really strong protective factor. Having that family support, having that family that are prepared to step up and take on the additional responsibilities when somebody goes south, that are there to provide that support for them over the season. And having access to really good support networks on station, as well as those support networks off station that they can link into if they do need support, or just to connect with somebody outside of this bubble that they are living and working in. And so these risk factors and these protective factors very much inform the selection process. We put a lot of effort in the way that we select expeditioners into the program. We select expeditioners in who have the technical, professional skills and have the ability to adapt to this environment. So we are selecting in a psychologically, physically, and technically competent population. But there will be things that will impact upon that over the season. So our selection process is really extensive and a high attrition rate. So we had over 2,000 applications this year for around 180 positions. So very high attrition rate, people want to go to Antarctica, but not everybody is suitable to go to Antarctica. And so it's really important for us that when we are selecting, we're providing feedback. We talk to individuals who are not successful about, you are amazing in what you are doing in your life, but you don't have what we need in the Antarctic context at this time. We're not making judgments about you as an individual. We're putting this in the Antarctic context. Because if we put somebody into an Antarctic context that is not physically, psychologically healthy, then we have the potential to cause further injury or illness to those individuals by the demands that we will place upon them. So expeditioners going through our selection process. Firstly, we're looking at their technical skills. That's where our biggest shortlisting occurs, but we need to make sure that they are technically or professionally capable of doing the job that we want them to do. We also put them through an assessment centre, looking at their personal qualities. We've done it virtual this year as a COVID response, but prior to that, we'd put people together for a 24-hour period, replicating to the best extent that we can an Antarctic station in a hotel, but living, working together to see how they interact in this diverse community. It's a really good opportunity for us to have a look at these personal qualities and around their suitability. They also go through the most extensive medical assessment. We need to make sure that they are physically healthy with no injuries or diseases that might arise on station, because we cannot provide the same degree of medical support in Antarctica that we can provide back here in Australia. And then also, which is my area of responsibility, quite an extensive psychological assessment. We need to ensure that the individuals that we are bringing into the program have the capacity to adapt effectively to the environment that they will be living and working in. Having selected them into the program, there's then a fairly extended, for our wintering expeditioners, training period. And that training is to prepare these individuals to live and work in this context. If they are confident, if they are competent, if we're seeing good self-efficacy, then that has positive indications for the mental health and wellbeing and their ability to adapt to those challenges across the course of the season. So from an occupational perspective, quite extensive technical training. We bring in people that are technically qualified, but we need to upskill them to apply those technical skills or those professional qualifications in an Antarctic context. We do a lot of work about preparing them for this social, small community type setting, and about establishing those bonds as this wintering community before they go south. So, we have introduced recently what we call Station Week, and 2 days of Station Week around the soft skills, for want of a better term. It's about individuals in this community understanding different styles in the community. We're all different. Because you react this way doesn't mean it's wrong, but somebody might react a different way. So it's very much about recognising there are different styles in this community. We also do work with them around behavioural expectations. And I think that talks a little bit to what Andrew was talking about earlier around inappropriate behaviour and the impact that can have on a small community. So we talk to our expeditioners around our behavioural expectations. And we also get them to develop their own team charter that they have ownership of in how they are going to live and work as a community. And we remind them of that across the course of the season. It's very easy for us to have a team charter that we impose, but if it's developed within the team, they take ownership and they're far more likely to live that charter during the course of their season. We train people for the environment. We want people to feel competent and confident living and working in this adverse community, this adverse Antarctic setting. And again, if they feel confident and competent in their skills, then that has positive impact on their well-being. And so expeditioners go through survival training when they first arrive in Antarctica. They will undergo training to travel in Antarctica. And that training is repeated across the season just to maintain that competency of those skill sets as well. And the other area about that preparation is the psychological preparation for living and working in this context. And so I do work with our wintering expeditions before they go to help them to understand what are some of those psychosocial demands that I spoke to, and what are some of the strategies that they can employ over the season to help them to adapt and respond effectively to those strategies. And we also have what I think is a brilliant resource, which is our separation guide. It's not about teaching people to separate from their partners from a negative perspective. It's about giving them information to support them in managing that separation period. And the separation guide has information for expeditioners, but it also has information for partners about how to prepare themselves and to support their family during that period of separation. We have information in there about, if you have children, how to manage the period of separation from your children as well, which is a really great psychoeducational resource. The next area on the slide there is about supporting positive self-care. Now, positive self-care is fundamental to all of us in all aspects of our lives, but it's something that I find that we need to reinforce when we are talking with our Antarctic community. Because what we do back here to look after our self-care, we may not be able to replicate in an Antarctic context. So we need to think about what do we do to maintain positive mental health and wellbeing through self-care strategies in Antarctica. And this talks to some of the things that have already been spoken to, but things like a good diet. Now, there is very limited fresh food in Antarctica. So if you are there for 12 months, I have learned that eggs and potatoes last a long time, but not much else. But we have chefs on station that do an amazing job in providing a nutritious, healthy diet for our expeditioners. And we do have a hydroponic setup on our stations that provides a limited amount of fresh produce. People love working in the hydroponics area. It is light, it is warm, and there is the smell of fresh things growing that when you have been away for a long period of time, that is something that people really appreciate. And in fact, we're doing work at the moment about how do we enhance wellbeing, and we are looking at, do we have the capacity to increase our hydroponics facilities, because it's such a positive aspect from a wellbeing perspective. Exercise, again, really important from a wellbeing perspective. But if you're a marathon runner like Matthew, you can't go out and run long distances in Antarctica. So you have to adapt your exercise strategies. So we have gymnasiums that are really well equipped on all of our stations, cardio plus strength type equipment on all of our stations, and encouraging our expeditions to get into the gym, and to exercise and to maintain an exercise routine. And one of the good things about COVID is it opened up the virtual world to us. So we're now seeing expeditioners linking into virtual PT classes that are happening back home, linking into yoga classes. And that has been amazing because it actually promotes routine. People feel if they've signed up for a class, they feel more obligated to attend that class. But what is even better from my perspective is that they are connecting with people outside of Antarctica in that class that they are participating in. So that's been an absolutely brilliant outcome from a COVID perspective. It's important that people pursue interests and hobbies in Antarctica and they utilise their spare time in an active way. And again, the sort of interest hobbies they pursue back here may not be something they can take south, but there are a whole range of things that they can do on station. People take down the most amazing hobbies. I've seen people who've built canoe kayaks down south. I know a chippy who actually built a double bed down south and got on the ice with these most amazing photos that got into a carpentry joinery type magazine. But we really encourage expeditions to use their spare time in an active way. It can be really easy in your spare time just to go back to your room and put on a DVD, put on, that's old terminology, isn't it? To put on a movie and to watch a movie or a streaming service. But we don't want our expeditioners to be spending all their time in the room by themselves. We want them engaged in the community. So we have hobby huts where expeditioners can go and do craft work. Midwinter is really important for us in the Antarctic community. It's the Christmas equivalent in the middle of winter. And expeditioners take great pride in making gifts for each other and they share their skill sets. And that is absolutely brilliant. So that active use of spare time is really important. That routine that I mentioned there, I think is one of the most critical factors for expeditioner wellbeing, particularly in the middle of winter, where there is that continual darkness and you don't have the normal triggers about getting up, time for dinner, time for bed, etc. So having a routine that you maintain over the season is absolutely critical, and it's something that we talk to the expeditioners about. Also, just a quick sort of side note there about separating that work and non-work perspective of when you're living and working in the same environment that we've all experienced of late, is that we talk to expeditioners about building transitions into their day to try and separate work from non-work aspects. So even something as simple as coming back from the workshops and changing your clothing before you go to the mess has a significant positive impact. They're little things, but they can make such a difference to that well-being in this community. Maintaining the social connections. We know that social supports and social connections are really important to our mental health and wellbeing, and that's something that we really promote and foster within our Antarctic communities. And so we have pretty good comms on station. Not as good as what you might have here, but expeditioners have a phone in their room that they can directly call home to their family and their friends. They have access to social media. Internet connectivity has certainly improved. Again, not as great as what it is here, but it is pretty good when you think about the environment. And it's only been in the last 4 years that we've been able to facilitate video contact with family and friends back home. Prior to that, it was phone or email. And not being able to see your loved ones for a long period of time is not the most positive experience. So the fact that expeditions can now link up through video conferencing, again, we've seen some great outcomes from a wellbeing and from a staying connected perspective. Another self-care strategy that we know is really important is about good sleep behaviour. That can be challenging in Antarctica. Again, when you think about those light cycles, circadian rhythms, and also, Antarctica, she's a desert. And so there was really low humidity, and those sort of things can impact on people's sleep behaviour. And so we try and address those through blackout curtains and again, that routine. But expeditions often talk to having disrupted sleep in that Antarctic context. And that is something that we're aware of when we work with expeditions about their sleep hygiene and their sleep habits. Organisational support. So in all of our organisations, we know that perception of organisational support, again, is really important from individuals in this organisation feeling connected, feeling appreciated, feeling valued, which then has positive implications again for mental health and wellbeing. So the things that are important to us from an organisational support perspective is that our expeditioners feel connected to the organisation, that they feel part of the Australian Antarctic Division. So we will often have all staff meetings where we connect all of our stations in by video conference. And so we'll have our 4 stations connected in by video conference, participating, in an all staff meeting. Each of our people on station, they have a technical supervisor back in Hobart, and we really encourage those technical supervisors to maintain regular contact with their expeditioners on station, so they feel connected. The work they're doing, that we are listening, we are valuing, and we are working with them to support them in their role down south. We learned some really good lessons in relation to expeditioners feeling valued in the way that we would manage our welcome home ceremonies. So, not that long ago, expeditioners would feel that they came back from Antarctica, they're not ongoing employees, so they come home, they get off the ship, and they felt as though they'd been dumped by the organisation. Thank you, go and have a nice life. And there was a lot of feedback around that. And so in response, we now have in place welcome home ceremonies that we bring family to. We have welcome home pins and patches and memorabilia that we hand out. A member of the executive is there to actually welcome home, to thank the expeditioners, to thank their families for allowing their loved ones to come and spend time in Antarctica, recognising the demands on the family. And that has been really beneficial, and expeditioners feel valued and they feel connected. And so do the families, because if we can connect with the families, then they're more likely, next time an expedition wants to go south, to say, yes, I support you going south again. So feeling connected, feeling valued is really important. It's also important for our expeditions to be heard about their experiences. So, through the year, connecting with their technical supervisors to hear about their experience, but also at the end of their season, their technical debriefs, to spend time with their technical supervisor about what they did over the season. What are the lessons learned? They're keen to see improvement and inform the future of the program. So encouraging expeditions to share their experiences, that we are interested in that. And similarly from a psych perspective as well, with their psych debrief. Part of that psych debrief is around feedback about their experiences, so that they know that their feedback is helping to shape how we continue to deliver the program into the future. We are also very much aware of the environment that we are sending individuals to, and we are very open to individuals seeking early return to Australia if there are circumstances in their life that don't allow them to remain on station, and we can get them out. So that's only going to happen during summer. But if an expeditioner is finding that this is not what I thought it was going to be, or I'm struggling with separation from my family, for example, we will look to bring those individuals home. We don't want somebody on station who doesn't want to be there. That will have an adverse impact on them, and that will float out into that broader community and have an adverse impact on that community as well. Similarly, we have expeditioners who have been offered a job and then say, thank you, but no thank you. And we are really supportive of that. It takes a lot of courage to say, you gave me a job and I don't want it now. And again, we'd much rather that to occur than somebody feeling obligated to take up a position. So as an organisation, we really communicate, it's okay to say thank you, but no thank you. That's much better for you, and it's much better for us as an organisation. And then I suppose the last point around organisational support is in relation to recognising things that are going on in expeditioners' world and their lives, and communicating our support around that. So, during the floods that we saw in Australia earlier this year, from an organisational perspective, from the director, messaging out to our expeditioners, for those of you that are impacted, your families, we recognise what's going on, we are thinking of you. Just that sense of we care is really important. And we've done similar things out to family members as well when things have been going on, that we acknowledge what is happening and we care. And we may not be able to do a lot, but that expression of we do care is really, really important as well. The next point on the slide there, from again that organisational support, is about providing a safe work environment. Now, I think everybody is very familiar about a physically safe working environment, but we also have obligations to provide a psychologically safe work environment. And I think industries across Australia are becoming far more aware of that. We have a much greater focus on ensuring that we are providing a psychologically safe workplace for our employees. And that is fundamental to wellbeing, to mental health, performance and effectiveness. So we are working hard to ensure that our communities, everybody feels included, everybody feels heard. One of the challenges that we have as a program is gender diversity. There are not very many women tradies in Australia, and that means that we don't have a great balance in gender in our trade population in Antarctica. So we're working hard to try and increase the number of women that come into our program. We're working hard to try and increase the people from different cultural backgrounds that come into our program, because that diversity brings different opinions, different ways of thinking, different ways of doing things, and we can only grow as an organisation by doing those sort of activities. But that feeling of psychological safety is so important if somebody is struggling. And everybody in Antarctica will have a bad day. It can be tough and everyone will have a bad day. But if people are willing to acknowledge that and to speak to people about that, then that removes the barrier to care. That starts to break down some of the stigma about seeking support and seeking assistance. So being able to feel comfortable to speak up, to be seen as an inclusive environment is really important from a wellbeing perspective. The transition home, a lot of work is put in place to support the transition home, because that can be a really challenging time for our expeditioners and their families. You've been away from your family, from your normal life for 12 to 15 months. Guess what? Life didn't stop while you were away. Life kept happening. And when you come home, you're playing catch up to some extent. And it can take some time for expeditioners to reintegrate effectively into their home environment, and for family and friends to come together as a unit after that period of transition. And so we know from the research that it can take up to 3 months for expeditioners to effectively go through that reunion process with their family and friends, and potentially up to 12 months to effectively reintegrate into pre-Antarctic roles and responsibilities. So they're sort of extreme figures, but it gives you an indication of it can be challenging. Now, we've got great communications, as I said, on station, or fairly good communication. And having good communication helps our expeditions to remain connected with their family on a day-to-day life. And that does help that reintegration when they return home. So one of the messages that we give to expeditioners is, when you ring home, don't just talk about what a great life you're having and all the penguins you saw today and all the icebergs that are out there in the bay. To stay connected with what's going on at home, to listen, to ask about those routine day-to-day things, so that you maintain connection with your family. And that helps with that return, that reunion and that reintegration process that people go through. When expeditioners are preparing to return home, the emotions that are going on for them can be quite extreme. Expeditioners will talk about excitement of coming home. They will talk about grief from leaving a group of people that they've lived and worked with for the last 12 months, leaving a location, an environment that they've come to love. They'll often talk about anxiousness, about what's it going to be like when I get home? Am I going to fit back in? What's going to happen? And so there's a whole range of emotions for expeditioners and for their family and friends. And that's really quite normal. So to support them through the process, all of our expeditioners go through a psychological debrief that I conduct with our returning expeditioners. And the intent of the psych debrief is to support their effective return home. So we talk about what the experience has been like for them over the season. I use the term the good, the bad, the ugly. And part of that is starting their reflection on what the season has been like. Part of that is to start doing some reframing of things that they might have experienced or been involved in Antarctica. And also part of that is screening for individuals who might experience some difficulties with the transition home, so that we can put them into appropriate support mechanisms to support that transition home. Another part of the debrief is around seeking feedback from expeditioners. Again, that sense of being heard about what the experience has been like for them. And then a third component, and probably from my perspective, one of the most important components, is that psychoeducation to support that preparation home. So both specific and generic psychoeducation to support them in that return process. And because we recognise that the return home can be challenging, we continue the EAP support for our returning expeditioners for up to 6 months after they return home, should they need any additional support. We have around a 40 to 45% return rate. So people love what they do down south. We often talk about what's the measure of success. And the measure of success is everybody coming home safely and everybody having had an amazing time. And there will be tough times for them. We talk about the primacy and the recency effect. People think about what it was like when I first got there and what it was like towards the end of the season. And then over time, the negatives, they fall away because often those negatives are magnified when you are living in this quite complex situation that our expeditioners are. And then part of the separation guide that I referred to previously also includes significant information to support that transition home that targets the returning expeditioner as well as their family and their friends. And the last point on the board there is around the support channels and what we have available to our expeditioners to support their mental health and wellbeing in Antarctica. All right, so there's a range of different support mechanisms that are available to our expeditioner cohort. So that immediate support, which is on station, I talk here about the term peer support. That is quite different to the term peer support in your agency. So these are not trained peer supporters. These are their fellow expeditioners living and working in the community with them. That's a key support mechanism for our expeditioners. Alongside that is our station doctor. So all of our stations have a doctor that is there permanently, and that is a key resource from a mental health, physical wellbeing perspective. And in fact, our doctors do a monthly medical with our expeditioners that is both focused on mental health and physical health to see how they are travelling across the course of the season. And then our station leaders. And then interstation. Again, that peer support, that connection with colleagues and fellow expeditioners across the other stations, because many of our expeditioners that are returning know each other and they'll reach out for that support from expeditioners on other stations. From a head office perspective, there are a range of support networks that are available for our expeditioners. So there is their technical supervisor back in Hobart that will have that regular connection to that individual. There is my role. And whilst I don't provide therapeutic support to expeditioners during the season, I provide a coaching support to our station leaders to support them in managing situations that might arise in the station community. We have our own polar medical unit within the Australian Antarctic Division. And through that, we have a clinical psychologist who is there to provide support to our expeditioners if there is a clinical need to do so. And Polar Medicine Unit also has access out to a range of treating mental health and general specialists across the country as well to ensure that we can provide that high level of mental health support if warranted. We have an expeditioner liaison position, and as it indicates, there's a liaison between the expeditioner and head office and also out to families. And often families, if there's something going on at home, it's not uncommon for them to contact expeditioner liaison initially to have a conversation, particularly if there's been a death at home and they're considering how do I break this news to my loved one that there's been a death at home. And every season our expeditioners lose loved ones. They lose parents, they lose siblings. Sadly, we've had expeditioners whose children have passed away while they've been in Antarctica, and that's really tough to manage. And so these support networks are really important. And again, one of the benefits of technology is that whilst we are unable to bring expeditioners home for funerals, for example, we can connect them into that funeral. And we've had expeditioners give eulogies from Antarctica, and again, feeling connected to their family. We have workplace contact officers that expeditioners can reach out to, and we're just in the process now of putting workplace contact officers onto our stations as well as a more immediate resource that expeditioners can have contact to. We have an integrity unit within the department, and this is very much around if there are inappropriate behaviours that expeditioners are seeing on station, that there's a confidential hotline that they can reach out to for advice, support, guidance around managing inappropriate behaviours. And also case management. So if we do have an expedition that is struggling, either from a physical, psychological, from a work-related perspective, we will bring a case management team together to support the station leader in managing that individual. This is that virtual world that we are living and working in. And then we also have access to a range of external resources. So professional services, and I think to what Greg spoke earlier on about accessing coaching. Not everything needs to be medicalised. Not everything needs a clinical approach. So we actually have a group of coaches that we can utilise to provide support to our expeditioners in Antarctica. And we brief them into the Antarctic context so they understand the world that our expeditioners live and work, so the support they provide is far more effective. We have an EAP, as do many organisations, and within that EAP is critical incident support as well as a manager hotline. And then also family and friends, of course, are a really valuable external support to our expeditioners. One comment that I would make around the EAP, or in fact 2 comments, we actually do work with our EAP to brief them into what it is like to live and work in an Antarctic context, so they are best prepared to provide support to expeditioners. Historically, we have heard stories where an EAP suggested somebody needed to get outside and do a bit more exercise. It's a bit tough when you're in Antarctica and the credibility. So that's become a little bit of a folklore, but what it highlights is the importance that the people that are providing support to our expeditioners understand the context, because it's very different to living and working here. The other thing that we would really like to see happen is an increase in EAP usage. Our EAP usage is not very high. EAP usage of manager assist is not very high. We want to see that escalate. And that doesn't mean that there are increasing problems on station. We want expeditioners to reach out to use the EAP in a proactive way. We want them to use the EAP to help them to flourish in the station environment. You don't just go to an EAP when things are not going well. And it's really important, something that we want to put more of a focus on is around communicating that. All right, the last thing that I would just finish up on is about how we respond to critical incidents in an Antarctic context. I feel very fortunate to be able to stand here and say this doesn't happen very much in our environment at all. When I think about the space that you are working in, the work that you do, for us, we don't have to respond to significant, frequent critical incidents within our workforce. When a critical incident does occur, for us, it is led by our EAP, and they take the lead in delivering that critical incident response. And we follow a model of psychological first aid. And so the response that we provide after a critical incident, it may be psychoeducation. It may involve screening. It may involve referral into clinical support if that need is identified. It may involve psychological assessment about somebody's suitability to return to duty. So the critical incident response that we employ, very much dependent on what the need is following the event and of the individuals involved. We also provide support to families following a critical incident because they are concerned about their loved ones. So they also have access to the EAP and any critical incident support that service may be providing. I suppose just 2 critical incidents that are fairly recent I can just talk to that shows how we might respond to some of the differences. So again, both open source incidents that you would have heard about in the media, but last year we had a fire on board Everest in the Southern Ocean as she was returning to Australia. A fire on a ship is a tricky situation, is a scary situation for anybody, and particularly when you're in the middle of the Southern Ocean. The challenges for us in providing a response after that event is connectivity to a ship in the middle of the Southern Ocean is very, very challenging. So what we put in place was that, in fact, WhatsApp was the best way of communicating. And so through WhatsApp, we had our EAP do some psychoeducational sessions for some of the key leaders on board the ship. So they were aware of what to look out for and what initial first aid they could provide to those individuals. And then when we got the ship back to Fremantle, myself and the doctors, we essentially screened everybody. If there was anybody that we identified that was demonstrating signs of a traumatic response of elevated distress, we then referred them into a clinical psychologist for further support. And we then did a follow-up, again, about 6 weeks after, to see how people were travelling. And we work on the basis that we have a psychologically healthy and resilient population. who are well prepared to respond to the demands of a critical incident, but we need to ensure that is the case as well. And in this instance, we also maintain very regular contact with the families because they were worried about their loved ones on the ship that was still travelling back to Australia. Another incident where we had to activate a critical incident in recent years was we had an accidental death in Antarctica. And so again, we activated the critical incident response through the EAP. There was a key group of people that we were concerned about, the first responders, for want of a better term, in our world. And so we did individual screening with those individuals. And again, we're identified, we refer them out for clinical intervention, knowing this is all virtual. So we are doing all this virtual back from Australia. And then again, psychoeducation for the broader community, for others on station, but not just on station, also for people across other stations who, even though they're not involved directly, they know the people. And so that effect can be extended as well. So that's just the highlights, how we manage, depending on what the circumstances are. But there are challenges when you're providing a critical incident response to a group of people that are in a remote and isolated setting. And the last point I'll talk to is just some resources that we've developed for our crisis management and recovery team. So this is a team that we pull together of our head office staff and external stakeholders to support us in managing a critical incident. Sometimes that team may need to be raised for an extended period of time. The nature of the event might require 24/7 operations, depending on what the situation is. People involved in this team will know expeditioners personally. People on this team will have spent time in Antarctica in some instances, and so they really relate to the situation, the circumstances that's going on. People on this team may be trying to continue their business as usual whilst they're providing support to the CMR. And so we've now developed a resource around promoting positive self-care for the CMR team, about recognising when something is impacting on me and I may not be the best person to be sitting on this team. Recognising when I'm fatigued and it's time for me to step back and for my backup to come in. Promoting within this CMR team that psychological safety, that good self-care is actually being mirrored from everybody in that team. And so anybody that is having any difficulties being participant in the CMR feels comfortable in saying, I don't think this is right for me. And that's such an important message, because responding to a critical incident can be as challenging as being intimately involved in the event, depending on what the circumstances are. So there you go. There's a little bit of insight into the Australian Antarctic program and mental health and wellbeing considerations.
All right, we might kick off again if that's all right. At 3 o'clock, please feel free to leave and go out and get some afternoon tea and just come back in. We'll do some Q&A or something similar during that time. Anna and I are now going to, I'm also very nervous about this, Maree. Maybe. We're going to talk about wellbeing support in the Tasmanian emergency services generally, and then also give you an overview of how we responded to the Hillcrest Primary School tragedy. You can see from the slide here that there's quite a number of points that I am very keen to get across. And part of it, I think, is important because we are a small state and we pretty much know everyone, and we're actually able to achieve a fair bit. So we like to think that in many respects, some of the approaches that we have, which we need to have because of our size, are actually indicative of a best practice approach. So unfortunately, you're going to get a bit of history in this as well. Next one. For our very first time ever, we have a mental health and wellbeing strategy. I won't go through it in any great detail there, but you can see that we have 5 principles and 4 focus areas. It's quite surprising to me that it's our first ever mental health and wellbeing strategy. We were very grateful to receive assistance from Beyond Blue and Victoria Police in our development of this, but this was a fully consultative process that we embarked upon, and the strategy document that we ended up with, we think is very, very sound. Now, whilst the observant amongst you will have noticed that we've lost our paramedic, that's because the paramedics are part of the Department of Health, and their mental health strategy will be within the Department of Health. So whilst we provide all services to them, that's the reason the paramedic is excluded from this slide. This has been a really important thing for us as an organisation. So we have moved to a wellbeing support model that very clearly puts the person and their family at the centre. And this has redefined how it is that we actually go about providing our wellbeing support services. Some of the really significant things that have been achieved through this are actually stepping away from our bureaucratic processes that are, for instance, in our workers' compensation legislation, and actually starting to think about the person as our pivot point, and then looking at what we need to do to make sure that we actually satisfy the other obligations, legislative and organisational. We also, and this is only because of Greg's impending retirement, we've also set up the employee volunteer life cycle, and we've recognised that for too long we've been doing the same thing despite where people might have appeared on their life cycle, and it's time to go back and reimagine it. So we are doing that now, and we're completely redefining all of our training and the like in respect of when people join, when they work with us, and when they transition to another role, whether that role is retirement or even whether it's promotion. And certainly from the police cohort, we have found that a number of police officers struggle with the extra responsibility of promotion. And so that's why we've included transitioning to another role within the life cycle. Now, I've spoken a bit about leadership in our organisations. So I work direct to the DepSec, but this is the board that runs my business. So you can see that it is the most senior people in the emergency services in Tasmania, and they are heavily invested in every aspect of what we do. We meet with them at least quarterly, and we obviously fulfil any work requirements that they have of us, but we also ensure that they are very much on the same page with the direction that we are headed in. It's a very powerful group, and their commitment to wellbeing has been astounding, and I do credit them for assisting us to achieve most of what we've been able to achieve, because the extent of their interest is so significant. Sorry, but here's a boring organisational chart. And I do just want to talk to this a little bit. So 2 years ago, we had 6 staff at Wellbeing Support. We now have 23.1 who deal with the wellbeing support side, and we have 6 who deal with IMAS, which is workers' comp. Workers' comp has only just come into the wellbeing support portfolio, and it's come in specifically because we want to put the person at the centre of the workers' comp process, just as they are at the centre of the wellbeing support process. Now, a couple of other key things that have happened over time, and under the assistant director here, so this side, that is our really important corporate business, but we've included there a program development coordinator, and his role is to examine all of our training and make sure that we are linking people into the best possible training for where they are at their career. We will have a 5-year strategy for delivering training to every single emergency service responder in the state, and people who are undergoing recruit training or promotion training will receive additional training. Managers and supervisors will get even more training, and we're starting to roll out our pilot for the manager and supervisor training in late May. Maree and I talk about this a bit. The organisational psychologist, we've deferred that. There's only 3 in Tassie, 2 are retired and the other one's sitting there. We'll look at advertising that again, perhaps late this year. We then have the psychology stream, and up until recently, we actually only had 1 psychologist, and we've only had 1 psychologist since 1993 until about January of this year, and we put an additional 2 on. We also have provisional psychologists that work with us from the University of Tasmania, and they have been particularly invaluable when it comes to doing our wellbeing checks. We don't use a standard EAP. We have got 101 external psychologists and allied health and allied mental health professionals. We have credentialed each and every one of them. We made them provide their university results, their upskilling, insurance documentation and their full CVs, and we've gone through and assessed each and every one and identified who it would be that would be appropriate for our workplace and for our people. They needed to demonstrate a couple of really important things to us. One was their knowledge and understanding of emergency service culture, and another very important one was the ability they have to prioritise our people over everybody else. So if we want someone to have an appointment and we say it's urgent, that's 3 business days. And if it's not urgent, it's 7 business days. We were starting to hit walls in Tassie, perhaps they exist here as well, of 4-month wait times. So that's why we've actually gone out and introduced this new model. We're just going through the process now of finalising our contracts with these providers. We've also appointed a client services manager, and I'll talk a little bit more shortly about our client load. But the client services manager sits over the top of our wellbeing support officers, and our wellbeing support officers deal with everything other than trauma, essentially. And our critical incident stress management program deals with the trauma. We have wellbeing support peers drawn from all agencies and inclusive of state service employees. And sitting slightly outside of us down the bottom there, you'll see is the Ambulance Tasmania Peer Support Officer Network, but we're looking to integrate that far more over the next few months. The CISM program, we have 2 full-time managers that run that, and we do all our own critical incident response. So it's not an EAP program that we utilise for that. We have now 74 peers, and we will have 100 peers by the end of the year. And we've just increased the number of psychologists on that program to 18. Now, just in respect of the CISM program, that's existed since 1988. And it's existed as a multi-agency program since then, inclusive of ambulance, because at that time, ambulance was actually part of our department. And even though they split out in about 92, they've remained part of the CISM program ever since. It has allowed us to deliver what I believe is an incredible service because we've got emergency service personnel from every agency being totally supportive of every other agency. It's built amazing bonds between the services, and it's also increased our capacity to deal with issues as they arise. And the one that I would always give is an example of a stressor is we will have a police officer talking to somebody who's pinned under a car and everything seems good, and then we lift the car off them and they die. we have paramedics who are in a position to actually explain fully how that occurs, and that helps us to a great extent. So it's been a tremendous thing, the critical incident stress program. And also, really importantly, we've just 2 weeks ago put on our early intervention analyst. And our early intervention analyst, I know in some organisations they exist within their professional standards or internal investigations unit. Our organisation has made a conscious decision to put the early intervention analyst in wellbeing, because we want to deal with this as a wellbeing issue, not as a discipline issue. And that analyst has access to an incredible array of information, including the information that's available at professional standards, at operational skills, police vehicle crashes, and will be able to identify people who are starting to come to notice for all the wrong reasons. So we're really looking forward to the progress that we'll be making in that area. We're actually going to look at Canada. We've already spoken to Ottawa and Edmonton. They're doing a powerful amount of work over there, and there is a huge amount that we can learn from them. So that is another game changer for us, and we're very much looking forward to that. This is the leaders video, and it should only run for a couple of minutes, but it's insightful. So some of the faces have changed, but that's the Wellbeing Leaders Group with myself and the Director of People and Culture added in. Now, you will have seen through that video that we had words flying in from everywhere, subliminal messaging. Make yourself the priority, look out for your colleagues, and know your people. And that is the mantra that we have. It's on pretty much all of our advertising because they are the key messages that we need people to be understanding and that we need to have delivered right across the organisation. So the way that we've done this is every emergency service has its own suite of posters so that we respect each emergency service. And the end one, the know your people, listen and lead by example, is consistent across all the areas. We also have separate posters for state service employees because we need to make sure that they are properly recognised as well. Everything that we're doing in this space in terms of marketing and engagement, we are putting as much effort as we possibly can into doing it well. We're not scrimping on the cost. The videos was a proper production crew, a proper journalist who was asking the questions. We have graphic designers that do everything, and we outsource the delivery so that we can have everything coming in a timely manner. When I was in this space in the mid-90s, we would throw everything on the photocopier and hope it came out all right. And I learned a very valuable lesson back then, and that was that if you don't look like you care, then the perception is you don't. So we're very fortunate in that we're now in a position to be able to do this. I spoke earlier about how through the original MyPulse, the original Project Wellbeing funding, we got $1.5 million a year. Last year, we got an additional $1.5 million a year, which allowed us to put on extra staff. Unfortunately, that followed the suicide of a police officer. And it was recognised at that point that there was a lot more work that was needed to be done. So aside from our general budget and some money that Andrew was able to get a commitment from government for, we have $3 million for the extra staff and to deliver the MyPulse project and the Ready for Response project. So there's a reasonable investment that we're able to make there. The other thing that we're underdone on, and I was interested to see it in Maree's talk, is the family dimension. So our critical incident stress management program has not been able to pay much heed to families just from a pure resourcing perspective. But we've now obviously identified that this is an area that we need to put a lot of effort into. and we are focused very much now on increasing that. So we'll be running information sessions around the state and inviting family members to those. We'll also be running information sessions for GPs, the psychologists that we're putting on, and any other allied health professionals, and we will pay them to attend because we want to make sure that they turn up, they listen to what it is that we can do, and they understand the sorts of services that we are able to offer to our people. And of course, we're working very hard to increase the wellbeing literacy. That has been harder than I anticipated it would be, but we're certainly headed in the right direction. This bottom line, life is good, life is a bit rough, life is hard, life is really tough. We stole that from Fire Rescue Victoria. I was at an AFAC meeting actually, and I saw that pop up and thought, well, we'll have that. So another indication of how you can pick up things from everywhere, and Fire Rescue Victoria was very generous in allowing us to use it. This mental health continuum is an option that we've just started really to exploit. We now have blank forms of these that we give to, or we will be giving to emergency service responders so that they can actually plot where they are in the healthy, reacting, injured, ill phase themselves. And then through the bottom, you can see the sorts of services that we've got that we can offer to them. And then we have on the piece of paper that they have the actual contact numbers so that they can access services. This has been very good as a ready reckoner, and we've been pretty pleased with the uptake of it. Now, stigma reduction is something that we have to work harder on. Our results out of Beyond Blue weren't horrendous, but it did demonstrate that we needed to put a little bit of effort into this, hence our lived experience videos and getting the leaders of the organisation to speak up. The key point that I would just focus on here that I think is essential is we must have our people take responsibility for their own well-being. The organisation can help, but they actually need to step up to the plate themselves. And it's a really important thing because, you know, we get some suggestions that the pendulum has swung too far. So we are very, very much in the mindset that people have to take responsibility for their own well-being, and we'll step up when we need to step up, but it's not a one-way street. The rest of it, I think, makes pretty reasonable sense. And that top line, we all have a role to play, is something that we are very much committed to. So our proactive and our preventative services. We run a lot of education and information sessions. We do mental health first aid courses. We're, as I mentioned, developing courses specifically for managers and supervisors. We've been through health clinics and ready for response. In the leaders video, that gym activity that you saw, that was a ready for response class. And where we can, when we get our contracts with the gyms, we try and get them to commit to only having classes for emergency service responders. So it's just us in the room. Wellbeing checks. We currently have 70 police officers that have to undergo mandatory wellbeing checks per annum. We're about to increase that to 330. We're talking with the Tasmania Fire Service to identify whether or not any of their positions should also undergo mandatory wellbeing checks. And historically, the position was the police officer would have to come to us, but we're now going to go to the police officer. We're mandating it for all remote and rural police stations because we've had quite a number of issues that have been identified through that process. I've mentioned gym memberships, and of course we've covered MyPulse. I won't go through these at any great detail, but just to say, I mentioned that critical incident stress management, they do all the trauma stuff. and the wellbeing support officers on this side cover everything else. And it's complex, but it's also as simple as we provide car parks. If people are in hospital and their family members need car parks, emergency housing, if emergency housing is needed, and we're just looking to get access to more houses around the state so that we can put people up in emergency situations. I like stats. I just thought I'd show you this one. So last financial year, there were 328 incidents reported to the Critical Incident Stress Management Program. And this year, as at last week, there were 300. Of those, you can see that just under 30% of incidents lead to at least one person being referred to a psychologist. The number of individuals contacted last financial year is 500 less than this financial year, and we've got 2 months to go. So the rate of use is increasing dramatically, and it is year on year. The figures in terms of individuals contacted by a psychologist are reasonably consistent, and the number of one-on-one sessions with a psychologist have increased, and that is largely due to the Hillcrest Primary School tragedy. From a wellbeing support perspective, we count what we call episodes of care or episodes of support. And so if, for example, in 1 year I'm diagnosed with cancer, I'm having a relationship breakdown, and I've suffered a bereavement, that would count as 3 episodes of support. So we're averaging 77 non-COVID ones per month, which is quite high for the state of Tasmania. And as you can see, we average 130 new clients each month across the current financial year. At any one point in time, we're carrying a load of 600 clients that are non-CISM clients. And we actively manage those through the client service manager and the psych team, so that we're opening and closing matters as they can be closed. We refer out to psychs as our primary aim, and we try to ensure that the wellbeing support officers are not delivering any form of counselling. And we also have needed to change the parameters a bit so that wellbeing support officers can't become employee advocates for people. So we've very much had to define their role as non-employee advocates. The only person that is allowed to advocate for an employee is the person fulfilling my role, so the Director of Wellbeing, and I would only ever do that if it actually gets to an exceptional level. As a consequence of being able to do that, and essentially it's when something's not making sense, we've been able to get police officers transferred to a variety of positions just to mitigate the risk and to reduce the harm that was occurring. So that's the advocacy role that we have. Now, I'll just briefly mention the Port Arthur incident. So it was 26 years ago, and as you can see there were 35 people that died and 21 that were injured. And amazingly, there were 865 witnesses who were actually interviewed. The number of statements, some gave 2 statements, so the number of statements that were given were around 1,400 or so from memory. But incredibly, there were 685 emergency service responders involved in that response. And the thing that I would commend all of you to think about is how are you going to manage that many people if you have an incident that involves that many people. We were fortunate back then in that we struck upon a model that we thought would work, and fortunately it did. But it is a really difficult undertaking, and I think that part of the risk that we all take is that we actually don't think through and look for the worst case scenario, and that should be our starting point. So when the Port Arthur incident happened, we had a team of 65 that were involved in the response from a wellbeing perspective, and it was primarily the critical incident stress management program that was involved there. And you can see that we had 22 mental health professionals, 37 peers and 6 admin assistants. We had to rely upon New South Wales Police, Victorian Ambulance, the Family Court of Australia, and other people in order to get resources on the ground to allow us to deliver the services. And one of the things that in our thinking had never crossed our mind was that we would lose our clinical consultant on day one, and that we would lose some of our other really important managers on day one. And that was because of exposure at the scene, because we have many roles. Our clinical consultant was also our psych advice to the negotiators. It'd been down there for a long period of time and was not in a position, to provide any clinical consultant advice. So we needed to really rethink what we were doing, and the lessons of Port Arthur are lessons that we still live with today, because they have been incredibly important. So with that in mind, we have response plans, and they can be very, very significant. And we run through the various phases that we think we will need to have in order for us to properly support our staff. The sorts of incidents that we would run a response plan for will be coronial matters that are quite significant. And we have a different mindset if it involves Tasmania Fire Service people to if it involves paramedics to if it involves police, because their experience of the court system is completely different. Suicide of an emergency service responder. With our officer that suicided in October 2020, we got 181 clients out of that matter. And that is a really significant number of people that you need to manage and need to manage well. So that's why we will always do a response plan for a suicide or an on-duty death. And once our numbers start getting up over 100 for any sort of incident, irrespective of what it is, we will think about whether or not we need to run a response plan. So going to Hillcrest particularly, it was the 16th of December last year. There were end of year celebrations, and those end of year celebrations obviously involved an activity day. It included a jumping castle and zorb balls. There was a whirlwind that hit the school. No wind had actually been forecast, but a whirlwind hit the school, and it hit the precise area of the jumping castle, the zorb balls, and also the gazebo. The jumping castle, and I got this bit from the media, so I can't go to the accuracy of that, was about 10 metres off the ground, and it was tumbling as it was moving through the air. And there were children that were in the jumping castle at the time, and also with the zorb balls. So as is normal, all emergency services attended. That's why we think our model works nicely, because we're able to provide services without treading on the toes of other emergency services. There were really significant attempts at resuscitation. It was a very complex, difficult scene, and obviously it involved young children. Helicopters were dispatched from Hobart. They obviously had police and paramedics on them, but they also had quite a number of medical intensivists that came up as well.
I need to make sure I speak loud. I wasn't talking loud enough. I think, Maree, you referred before to one of those things as the A factor. So we have those in police as well. So my background, just so you know, 16 years is in police, police sergeant, but now working in wellbeing support with Matt. So I think one of those that day was an AFAC today, if I can refer to that. I was performing the role as assistant director at the time, and talking about life balance, Matt was actually having a day off. So I won't forget it. I was having a cup of tea with a client and my phone kept ringing. And fairly quickly, we worked out that this incident was going to be quite a major incident, significant, and we were going to need to be able to make it scalable and get people on scene. So one of the things that came up for me was, why is it that I needed to go up to the Hillcrest situation? And for me personally at that time, probably I was thinking, I'm not probably the best person right now, and I'll explain that as we go through it. But why I was the best person at that stage was I was performing the role as assistant director. I've had training in the CISM space, and I've also worked as the CISM manager for a period of time, police sergeant, and also currently a wellbeing support officer. So it made sense for me to go up. Now, Matt did talk about having a response. Wellbeing support generally deals with proactive, but critical incident stress deals with response to trauma. The CISM manager at the time was inundated with calls. Things were coming through so fast. And for those that don't know, Devonport is 4 hours from Hobart. So this is unfolding as we speak. And we're like, okay, let's get some things into place here. So we thought it best that Darren, who's the CISM manager, stay back in Hobart, and myself and another colleague headed straight to Devonport. But there was a delay. It was about 4 hours or so for us to actually get on site. So when we talk about on-site, what on-site doesn't mean, and we've learnt this from the Port Arthur days, on-site doesn't mean us going to the Hillcrest Primary School, because once we go there, we're exposed and we then fall in part of attending a critical incident. So then we sort of rule ourselves out. So on consideration going up, and obviously lots of phone calls and lots of information flowing through really thick and fast, we decided the best place to have a setup was at the Devonport Police Station. It's nearby, but separate enough to be able to set up and scale it up when and if we need it, and then scale it back down. And in fact, after I think 3 days or 4 days, I think we actually moved it to another site because there was enough time of having it right there on scene. So the central idea for us en route there was to set up a command centre or an incident hub. And what we did was really focus on the people. And as we said, we put the people and their families in as a priority in these things. So we needed to be on the ground, listening and understanding what our first responders were going through and what in fact they needed. So that's what was really critical there. We're engaged with everyone from the commanders in that section, and they were feeding us information, inspectors, detective, sergeants, constables, and so on. And what we were then doing is feeding that information back to Hobart, and back there was a control centre set up, so they were able to then, I guess, allocate the numerous tasks that were required to execute the support that we needed to work on. So while this was going on and while I was travelling up, or we were travelling up, I should say, some CISM peers were already on site and wellbeing support officers were on site, but fairly quickly the wellbeing support officers were taken out because they were then transporting people to Hobart. So this is part of what we also do. But the CISM peers were able to run sessions and actually have discussion groups and unpack some of the day that was, and actually allow that group of responders to talk with each other and just share their emotion and I guess connect before they went home that day, because it was, you would have all seen in the media, it was pretty traumatic. And I've spoken there a little bit about making sure we remained separate from that scene. We had to really immerse ourselves in the station, and not just the station, but we had people on site at various police fire stations. The next morning we had people at ambulance TAS. So as officers came back to work or new people started, we had support there for people just to check in, wellbeing support people to check in, CISM members to check in, and really gain an understanding of what needed to be fed back so that the support options going into the weekend and the next week were being addressed. And I think Matt will touch on that as to what things were put in place to get the right support at the right time for our people. And one of the big things that was really important there, and being involved with the commanders and the various managers, was that term, know your people, know your colleagues, was so critical. Because at that point, people would say, oh, you know, Constable such and such has got this going on. You know, firefighter person has got this going on. Such and such has kids the same age. Others have kids that go to the same school. You know, there are all of these things that were coming out of it that made it really critical, again, for the information to get back down to Hobart. So the enormity of the incident was just incomprehensible. It was amazing. And in some of the positive things that came out of it whilst we were there was that everyone in Devonport's not a huge place, but Devonport was so much affected. And each of our stations, you've seen the images of the primary school, but our stations were full of food and flowers and teddies. And, you know, when we'd go to get a coffee in the wee hours, you know, people were just so grateful for emergency service personnel. So it was quite amazing, really. And I guess Devonport was on show for the whole world. You know, it was not just our little Tassie. Everyone was knowing about what was going on there. So what we were doing then, I guess, was making sure that on-scene information and the needs were being fed back, and then the tasks were coming back to us to get the support mechanisms in place. So I guess the last thing was personalisation stuff. So you've heard, make yourself the priority. And that's where it came back to me at that point. I was there for a few days, and as you do in emergency services, you know, you drop something straight away and you go and you do what you need to do. At the time, though, for me, I was going through a relationship breakup, you know, after 25 years. So it was a massive thing. The other thing that I had going on was my youngest is 11 and as the same age as these kids. And I was going through uncertainty, what's going to happen with my home, my kids, my life, all of these things. And that's when Matt and I spoke, and I just said, look, this, you know, I've got the skills and I've got the experience and I need to be there, but I actually can't. And it was, yeah, I know what you're going through. Okay, we changed it up really quickly. I then was the best person to deal with business as usual back in Hobart, where I could cuddle my daughter at the end of the day and not be, you know, worried about these things. So it was really important for us to walk the walk and talk the talk, I suppose. So yeah, I went back to Hobart, we engaged a whole new team, and the support continued to go forward. So yeah, that was my involvement on the floor up there. Thank you.
So we had 4 children that died that afternoon, and a 5th child died in the evening, and the last child to die died 3 days later. Now, one of the really significant parts of this, and any death is horrendous, but the 6th child was actually the child of one of our staff, and that staff member was actually from the Devonport Police Station. So there was all this activity that was focused around the Devonport Police Station, and we had, you know, a child that had been there all the time. Had, you know, mum was walking around there pregnant with the child to start with. So it was a really, really deeply impactful thing, and it still is. It's still going on today. So when we actually start to plan our response, you know, as you would all do, we actually start to identify what the issues are, and then start to look at what the most appropriate responses for those sorts of issues would be. The confronting scene, really difficult decisions that had to be made in terms of providing treatment to somebody and not providing treatment to somebody else. Very, very difficult decisions. There was general devastation and disbelief at the occurrence. There was high exposure to the injuries and also to the victims. And as Anna said, essentially the entire scene was just completely overwhelming. So it was a very, very complex scene for people to be involved in. The impact was felt right across Tasmania. There were people in my office crying because they've all had grade 6 kids at end of school. It was a really, major impact. People in shops were crying. There was the map of Tasmania had turned pink with a broken heart. So it was felt, very, very strongly everywhere. The victims were known. There was really strong personalisation of the incident. And you can see that, that only shows a fraction of the flowers. The flowers went an incredible direction this way. So it was quite amazing. And then we had the media. And of course, we generally speaking have a bit of a love-hate relationship with the media. I think that in this instance, they did nothing more than we would expect them to do. They were reasonably circumspect about some issues, but not circumspect around others. The 24-hour news cycle was huge. It was worldwide news. And of course, when that happens, the impact, to me at any rate, just seems to be magnified. As Anna has alluded to, I stayed in Hobart and I did that in the Port Arthur incident as well, because the bottom line is you don't need to be where it is because you run the risk of exposing yourself and then not being able to do your job. So I stayed in Hobart and I had a very solid team, because that's where our main office is, of people who were all set up, ready to go with all the computers and all the gear that we could possibly want. And so we set up our command centre there. But we were able to do this because, sadly, we have experience in this space and we have tried to do it mindful of what's happened in the past, mindful of the media, knowing what was going to be happen in terms of, there being this need for incredible and long-term support. The funerals were going to be really problematic because they were going to be dragged out. And so it was like, it went for an extended period of time. Now there's business as usual. And as Anna mentioned, she ended up scoring the business as usual situation. But also our borders had opened the day before and COVID was starting to hit the community, and we were starting to have police officers and other emergency service responders who were becoming impacted by COVID. So we had a huge increase in COVID clients and we had our normal new business that comes in as well. So we did a 6-phase response and our first phase was around CISM, and essentially we decided that that would be for 48 hours. And that 48-hour response was essentially just to get us over the line and to help us identify what our longer term needs would be for the 7 days beyond that initial period. Believe it or not, in this day and age, you've got to know who was there, because the computers won't actually be accurate with telling you who was there. So we put a huge amount of effort into figuring out not just who was at the scene, but actually what they did, because only then could we really try and identify what scope of work we would need to do in respect of them. Structured response, we'll talk about the structure that we applied shortly. And also we needed to make sure we dealt with the urgent requests. But this was just from a CISM perspective, from the trauma response. We, of course, had the situation with needing to provide additional support to other people at the police station that weren't part of this trauma response. Response 2 actually ended up ballooning up a fair bit. So it was the ongoing presence at the Devonport Police Station, and then we moved it to the SES building, which is just at the back of the police station. We needed to provide support at a nearby primary school because over the course of about 4 days, there was going to be interviewing of the children that were present and that saw it, so the witness interviews that needed to be done. We moved around the northwest in a mobile capability, and we took an assistance dog, or sorry, a couple of assistance dogs with us. We've not used dogs in that capacity before, but we found it incredibly beneficial. And it actually changed the dynamic. As soon as we walked in with the dogs, it absolutely changed the dynamics. D was to look at funerals, and there were some families that specifically wanted emergency service responders at the funeral, and they specifically wanted them there in uniform. And there were others that didn't want them there. And of course, then we had the funeral for our staff member's son. Now, from day 10 to the anniversary +1 week, we need to have a strategy. We can't just leave people on their own. So we've been doing quite a number of follow-ups on the way through and assessments. We're about to come due now for wellbeing checks. We're also looking at what we will do exactly when it comes to the 12-month +1 week mark. The structure of this was determined by a number of psychologists and also by the chief psychiatrist for the state of Tasmania. I can say to you that this is not something we've done before. This is actually quite new. We're not sure how it's going to go. It'll be interesting to see what the feedback is from our people, but we are going to step through it, and you know, we're hopeful that it will pay the dividends that we've been assured it will. Now, this third response was the support to our state service employee and her family. And as Anna mentioned, it did include transport to the Royal Hobart Hospital, accommodation, food, etc. And we provided 2 people at the Royal Hobart Hospital to support her and her family, and there were 8 family members present. And we did that for the 3 days until the child unfortunately passed away. And as soon as that happened, we had to make a whole range of decisions that you wouldn't necessarily think you would need to be thinking about. So the first thing was the family wanted photographs done, which is, you know, completely understandable, but they were struggling to find a photographer. And so it was then a question of whether or not we would be able to provide a police photographer to deal with that remembrance aspect. And then we had the family specifically request that the child be fingerprinted, and that it was our people that actually did the fingerprinting. So I've never experienced any of that before. You know, we do fingerprint children who have passed, but it's not something that we've done from a wellbeing support perspective ever before. We would absolutely do it again, but it's certainly food for thought. It's not something you expect. Immediately after the child passed away, we brought the entire family back to our office. And once the Commissioner of Police had finished with his media duties in respect of the announcement of the death, he came in and spoke to the family. He was there for probably an hour, and he put on a reindeer hat because there were other children present, and it was a really powerful thing for the Commissioner, and the family was incredibly grateful that the Commissioner was concerned enough about them to actually turn up himself. And then, of course, we had all of the funeral responsibilities associated with that. There were also a lot of other state service employees that need to be supported, including some that had just retired. So we needed to be sure that we didn't forget about those people that had been in the workplace for a long time, but had actually just separated out from the organisation. We did something completely different to support our own people. We appointed external psychologists just to focus in on the support for our people, and that is still ongoing, and I anticipate that that will be ongoing for a little bit longer. And then, as I said, business as usual fell to Anna. So quite a significant amount of work went into the response plan, and there was a lot of logistics and administration that needed to sit behind in terms of the delivery of the actual service. So there are 173 emergency service responders involved. We, I think, like all of you, define people as involved, inclusive of the people who were in the radio room. So there were a reasonable number of people that were in radio rooms that were attached to this. And this other line is an interesting one. It happened in Port Arthur. You get people that you're asked to provide services to that aren't your cohort. We will always respond and we will always provide services, but we have to be careful that we don't set a precedent and that we actually step back for future events. But yeah, that was quite interesting. We used, there were 28 other people that were involved. These were predominantly state service employees or others that were involved in the emergency response that were already our clients at Wellbeing Support, and therefore they didn't go under the CISM client base. And we also had 8 next of kin that we provided services to, and those services are ongoing. So this was our management structure, and it's almost exactly the same management structure that we used at Port Arthur. The clinical consultants would provide advice in the morning and then as needed through the day. And otherwise, it was a matter of the team getting on and doing the business. We had 2 on-scene leaders, one from Wellbeing Support and one from CISM. And their brief was not to get exposed to the scene and also not to get exposed to emotions, but just to deliver the frontline service delivery. I'll show you some figures shortly about the number of staff that we had there. But actually on the front line, we had Wellbeing Support officers and peers, CISM peers, and then we were fortunate in that we were able to take over a psychology practice and provide all our psych support out of that psychology practice. The admin team and the logistics team had a really significant amount of work to do. There were 10 of us in Hobart that was just driving this aspect of the business. And there were between 4 and 6 driving the on-scene management support that needed to be delivered as well. So it really is important that you've actually got people trained to fulfill these sorts of positions. We also had a strategy team. As information came to light, for instance, in relation to what might be happening with the Prime Minister, what might be happening with the Premier, visits to the scene by the Commissioner, by the Chief of Ambulance, you've got to start thinking differently and doing different things. So that's what that strategy team does, and that's what that looks to service. And of course, then the team welfare aspect. I had one person always allocated to team welfare, as well as the 2 external psychs. So for the Port Arthur incident, we had 65 people involved in the Wellbeing/CISM response. And for this one, we had more. And that was important because we needed to rotate people out. We also had somebody who just got back from the cricket in Adelaide, and he got COVID, and I could think of nothing worse than the Wellbeing team taking out an entire police station with COVID. So we did need to move people out very, very quickly. But what I was pleased about there was that we actually had the depth to manage this from within the state of Tasmania, whereas, as I mentioned before, we were needing to bring people in. And whilst that was tremendous, we still had some leftover capability if we needed to. So I've probably already bored you to death, but to me, a comprehensive structured response is the only way that you can manage the task because it is so significant. The command structure, you can't expose your management team. The temptation to go to the scene is strong, but it has to be resisted. The forward commanders, for us, I needed to have both there because they do different things. And our processes actually work. So we were just able to deploy them in far greater numbers. And fortunately, as I've mentioned, we had access to incredible resources. And because of the way that we do our business with the psychologists, they just stepped up to the plate and worked all weekend and things like that to help us through. You've got to run a running sheet. You've got to do an issues register. You must make sure that you fully describe who did what. And it's important to be able to reconcile that list with the management from the various emergency services. Regular team briefings are extremely important to make sure that we are all singing from the one song sheet. And as I mentioned, the issue in relation to team welfare and external providers. I mentioned about the assistance dogs, and I can say to you that I've been absolutely stunned. We were running a pilot of assistance dogs. We started it in November, and the feedback around the stations was pretty good. And I know the feedback with Ambulance Victoria has been tremendous, but wow, absolutely amazing. And if this ever happens again or anything close to this, that'll be the first thing we do is get hold of the assistance dogs and bring them in. The other thing is supporting the leaders. And one of the things that we do, the leaders have no choice but to speak to a psychologist out of one of these incidents. Commissioner of Police, Deputy Commissioner, Assistant Commissioner, they have no choice because we need them to demonstrate their commitment to their own well-being. And of course, then we want them to talk about it openly so that everybody else understands that this is normal. It is a really important thing. Choose your psych carefully. We used one of our CISM psychs. We actually have one in particular that we use for the senior leadership, but it is a really, really important thing to do. Don't think they don't need it. It's a very important thing. And you've got to be nimble because the damn thing changes so quickly. And I think at the moment, we referred 73 out to psychologists. There were 202 sessions that were conducted. We currently have 5 on workers' comp. As we learnt through Port Arthur, there is a really long tail on these things. We're still losing people through Port Arthur today. And so we don't know what the future will look like, in respect of this. But it was a particularly tragic incident. The numbers referred to psychs is really high for us for any one incident, but it was a positive outcome. And this photo was syndicated around the world, and it shows 2 of the younger police officers in all their humanity. One of the things that really stood out for me was that when they saw that photo, they were desperately worried that they had embarrassed the police department, and the commissioner rang them immediately and expressed to them how proud he was of what they did. So that's a really positive thing when you've actually got a Commissioner of Police who is prepared to do that. And obviously it was a very poignant moment. The other thing, and you would have seen from Dermot and his opening today, that he is a very humanistic and warm-hearted person, as is the Commissioner, as is the Chief Executive of Ambulance, Joe Acker. Their commitment to heading to the northwest day after day to support their people was amazing. And I'm actually not as across as I used to be the Police Commissioners of Australia or anything, but if your bosses don't look like they're heading that way, make sure they go, because it is a very powerful thing. And I'm happy to take any questions.
I asked a really ignorant question in some respect, but as someone outside the services who's watching with interest, what appears to be a really program that I'm sorry, that on, is it on? Yeah. That appeared not to catch you unawares. And without blowing your trumpet, I suppose, in that sense, but is it, should the members of the public be comforted in the fact that similar planning and processes are in place around Australia, or do you see this as being quite unique?
I confess I don't know the answer to that question. I would like to think that all emergency service agencies have a similar approach, because this is our business. Tragedies happen and we have to respond. And I would really like to think that they can step up. Now, we are fortunate because we've been unfortunate. We developed this in the mid-90s. We've had to roll it out a few times, and we just try and make it better each time. But it is absolutely something that I just think every emergency service should have. And for example, when we speak about a management team of up to 16 on any one day, you've got to have that, because you can't deliver it in a disjointed ad hoc way, because you'll miss too many people. But a lot of people would go, I haven't got 16 people to allocate to this, whereas it's our main priority. Yeah. I'll go through them. So the psych services and things that we have, because of what we've been doing in terms of awareness raising, our access to external services has been high and growing. So MyPulse has not affected that in any real way. How do they relate? To be honest, I think we overdid confidentiality on MyPulse. We needed to do it, but I think we've overdone it, so they don't relate. For one of our staff to disclose to a psychologist that they've done MyPulse and they're getting coaching is up to the client. We won't tell the psych because we don't know unless they've told us. Yes, the IT literacy has been an issue, but that has been primarily around volunteers accessing their v.email address. So we've been able to rectify that one. In relation to the overall costing, I very cleverly put Sam's email address in there. From our perspective, it's commercial in confidence, but if Gallagher Bassett would like to disclose it, that's a matter for them. The evaluation is ongoing through Edith Cowan University. We don't have strong figures in relation to the training materials except for the lived experience. And as I mentioned, except for the virtual learns. And they haven't been well received because, as I indicated, people would much rather face-to-face. The certificates came on late, so I'm not sure of the actual numbers that have been issued, but that was a brainchild of the Prospect Fire Brigade, so it came on very, very late. And people can go red on the DAS for any of depression, anxiety, or stress. It doesn't need to be a combination. Yeah. Yeah. So our contract is with Gallagher Bassett, and Gallagher Bassett subcontracts the coaching to rehab management, and it's the staff of rehab management that do it. They are exercise physiologists, counsellors, etc., etc. And yeah, they're outstanding. The feedback has been amazing. And pleasingly, they don't have a high turnover, which has been very important for the success of the program, because we actually have people going red who want to see Dom or want to see Trace. So that has been very important. Yeah. Right. So if you could, this is fantastic. Join me in thanking today's speakers, and I'm a very proud Tasmanian, so it's very nice to have all of you here. So thank you. And I'd now like to introduce Simon Stewart, the founder and managing director of Stewart Heaton Clothing Company, who of course are the sponsor of today's masterclass.
Thank you, Matthew, and good afternoon to you all. I'm mindful that I'm actually the last speaker here today, so you're all probably looking at your watches and looking towards catching planes or heading home. But for those that I haven't met, just a little bit about our organisation. Stewart Heaton Clothing is my company. We started about 31 odd years ago. We are manufacturers and suppliers of protective apparel and total apparel management services, so top to tail service to a number of fire agencies and police services across Australia. Many of you and your officers would be wearing our gear. And one of our objectives, obviously, in that process is to keep people safe, keep them visible, and keep them looking good. And about on our 25th anniversary, of the founding of the business, we thought, oh, look, should we have a party or, get together and have a great time and congratulate ourselves how great we were and how we survived 5 years and 10 years and 15 years. But actually, as a management team, we sat back and said, look, really, do we want a party? Is that really what we'd really want to do? And so as a team, we decided, hey, look, is there a cause out there that we could devote some money to that would have a lasting impact, would be relevant to our customer base, which is around police, fire and emergency services. And so we, surprisingly enough, approached a few police services in various jurisdictions and fire services, and no one sort of knew where it fitted in because everyone was running their own programs and so forth. And in the end, we approached AFAC and Stuart Ellis and said, look, hey, we seem to be having trouble giving money away. And he said, have I got a place for you? So no, Stuart was very supportive of it. Mental health is clearly a very big issue and deserving of funding, deserving of resources. And so we came up with the concept of the leadership in leading practice in mental health. And that award is given out each year at the AFAC conference. And I gather many of you are practitioners in that area, so you probably sit on the various subcommittees. So we've been really delighted with that involvement. And I think, as mentioned earlier today, the 2022 award, there's been a call for for nominations for that award to be awarded at this year's conference in Adelaide. So we're delighted to be involved. As to reflections, not that many, apart from the fact that one of the conditions we placed on our involvement with the award was that whilst it was in the AFAC playpen, for want of a better term, what we wanted to do with the masterclass was ensure that all emergency services agencies could have access to the masterclass. So police, which I know Tasmania is a unique organisation in that sense, because you have them all under that umbrella, but as you're aware, other jurisdictions are much more segmented in that respect. So I haven't had a look at the attendance list for today, but I'm assuming there's a number of people from various agencies involved. So one of the biggest reflection, I suppose, in that sense is just there is no panacea, as we know, to the issues there. And therefore, there are lots of solutions to an emerging and existing problem. And the way that we can assist in that process is to share the learnings. And I think today we've seen with the MyPulse and the experience with the primary school, some really positive learnings to take out of that. So, and I think the only other reflection I have is Andrew's observation and involvement with engaging the volunteers. And I know certainly from our perspective, we do a lot of work with rural fire agencies and SES units and so forth. And so, their need is widespread as well. Certainly we've seen the approach to PPE. The career, obviously a lot of focus on that, the impact of carcinogens on garments and laundering and so forth. And we're madly laundering career product, and then poor old volunteers whacking his wildland gear in the washing machine with his. So there's lots of work happening in that sort of space as well. And, of course, the issues that on mental health don't just relate to career firefighters, but also very much the volunteers as well. So good on you, Andrew, for bashing a few pollies over the head. And well done. So that's it. So thank you, and I might see a few of you in Adelaide. So thank you.
Thanks, everyone. That's brought it to an end. Very happy to take any email inquiries or anything from you if you would like. And it's being made available, PowerPoint, etc. is being made available, so it will be there if you would like to do it all again. Thank you.